Morning, everybody. Welcome to today's Mind the Gap Learn and Share webinar. I apologize you can't see me because I'm having issues with my Teams. If I put my camera on, it will just kick me out. So apologies. My name is Stephen. I'm part of the Commitment to Carers program. First, would like to say thank you all and congratulations on getting funding to carry out this important piece of work. We hope this will continue to drive, the NHS long-term plan to reduce health inequalities within the vulnerable communities. And thank you for submitting your first interim reports. We look forward to hearing more about the projects today. Just to say, today we have a total of 17 sites presenting. We have 4 who are doing the embedding work and 13 doing the scoping work. Each site will have 10 minutes to present. Please note, I will have to stop you if you go over the 10 minutes. I apologize, I have to be strict because we need everybody to have the same amount of time. We have a break at 10:55 to 11, and then a long lunch at 10 past 12 to 12:50. We also have the external evaluators with us today, Dr. Sarah Greenhow and Dr. Sarah Tickle from Liverpool John Moores University, just to introduce themselves and how they will be working with us all on the project. Towards the end, we have 30 minutes for any questions that you might have. But during the webinar, if you've got any questions, please just put them in the chat box and we'll be able to pick them up from there. And just a few housekeeping announcements, just to say we've placed you all on mute just to avoid any background noise. So again, please use the chat box. And today's webinar is being recorded, as you probably would have seen, until between 10 till 3, and the slides and the recording will be available at a later date. And not eating much of your time, if people are happy to start, we can just kick it off. So the first project that we have is, we're starting off with the embedding project. So the first one is the South West London Health and Care Partnership, ICS. We've got Claire Thomas and Andy Whittington. They're addressing digital poverty, supporting family carers of people with learning disabilities, autism to connect. Claire Thomas and Andy, it's over to you.
Thank you very much indeed. Good morning, everybody. My name's Andy Whittington. I'm Chief Executive of Merton Mencap, a charity supporting people with a learning disability and or autism and their family carers. Next slide, please. My words aren't about Merton Mencap, of course, but just for context, we're a local independent charity formed some 50 years ago, and our area of operation is the London Borough of Merton in southwest London. Our 100 or so which is run by people with a learning disability, supported by our staff. Now, many people on this call will know that the learning disability community has been affected hugely by the pandemic. In February, Royal Mencap research showed 8 in 10 deaths of people with a learning disability are COVID related, which is a very sobering statistic, you'll no doubt agree. People with a learning disability died from COVID-19 at 6 times the rate of the general population. Now, these stats are deeply troubling to us here because we already know that people with a learning disability die on average 24.5 years younger than the average population. And added to this problem is that of isolation triggered by the pandemic lockdowns and the understandable reluctance by many people affected by learning disability to rejoin mainstream community now that lockdown conditions have eased. So some people on the call will recall that our phase 1 research funded by this programme exposed the significant problem of digital poverty, digital exclusion facing carers of people with a learning disability and autism. We reported the complexity of the issue, including how barriers to digital exclusion cannot be overcome by simply providing greater access to digital devices. And this slide shows some of the common views from people with no access to the internet. Now, at the heart of the problem is some carers' understandable poor awareness about the benefits of digital use. Those who have no access to the internet often see little value for it for them and the person they care for, and many carers that we spoke to consider the digital world as a complex, costly facility which is both out of reach and not really relevant to them. And some older carers may, again, understandably take the view that they have it's too late to start now approach. Now, exacerbating the problem is the assumption many carers have had that the internet access is impossible for their disabled son or daughter if they have complex accessibility needs. And a further problem we identified was digital exclusion by proxy, which people on the call might know is when a parent or carer may regard the internet irrelevant for them. And as a result, the person they care for is also denied access. And this problem is evident in respect of family carers and also paid carers in care settings. But for many family carers, the view that the internet is irrelevant or inaccessible is perhaps the greatest barrier to reversing the problem of digital exclusion. But our phase 1 research also revealed the enormous value to life for those carers and people with a learning disability and autism too, who do have digital access. Next slide, please. So therefore, for our phase 2 work, our work now is producing a high quality film which case studies how carers and people with a learning disability and or autism do routinely use the internet and the wide-ranging benefits of doing so. And we intend for the film to show how people's lives have actually been transformed by digital use, which they regard now as an absolutely essential aspect of their routine and life. And it will also show how assistive technology can resolve challenges related to age, disability, low literacy and low numeracy skills. And you'll see from the slide there, we decided on 4 broad purposes for the film, which I won't read out, but they're evident there. Generally speaking, I'd say that our aspiration for the film is that it provides its key messages in a positive, optimistic and accessible way so that viewers who currently feel the internet access may not be possible for them and the person they care for, well, they are persuaded and they feel differently after seeing people in similar circumstances to them accessing the internet. Next slide, please. So our aim for the short film will case study 8 people, we think, which will include young people and adults with a learning disability and or autism who will demonstrate on film how facilities such as assistive and adaptive technology has enabled their internet use for varying benefits, and that family carers who regard routine internet access indispensable now in managing their lives. So we're hoping the short film will serve as a tool for professionals who are supporting families and demonstrates to carers how their lives really could be improved by digital access. And we regard this is likely to be the first step to supporting people away from digital inactivity. And the film will also provide information about available facilities which support people to overcome any accessibility barriers. Next slide, please. So we intend for the film to have a wider reach than in our area of operation down in southwest London, in Merton, so that the film will be made available to and be relevant to people affected by learning disability and autism across the UK. And you'll see, if we can have the next slide, please, that the outcomes we're aiming for are for really two groups. So the people with a learning disability and carers, to get that understanding of how the internet would change their lives, really get a clear message on that, and they then wish themselves to want to use it. And also professionals who are supporting families feel more able to demonstrate the value and benefit of the internet and the positive difference it could make to life. So it's supporting both the carer, the person with the learning disability, and professionals who are supporting them. So the final slide, please. Finally, I mean, our message is to thank the commissioners very much for their continued support for this work, because we're very grateful to receive the funds to carry out this project, which we think will help address the really complex problem we reported in phase 1. So many thanks to the commissioners for supporting us, as I say, and I very much look forward to seeing the excellent work of the other commission groups today. I think we may have a few moments for any questions for us, if anybody has any now. Thank you very much.
Thank you, Andy. That's some fantastic work there, especially with the digital stories for carers. They're really powerful, and they do sort of highlight the importance of the work that people do. Are there any questions for Andy? If you do have them, or if they come up, please just put them in the chat box and we'll be able to pick them up as we go. We have time set aside, like I said, for questions later. So please keep your questions and you can ask them later on. The next project that we have is the Cambridge and Peterborough ICS, which is supporting Gypsy and Roma traveller carers. We've got Tony Elliott, Andy McGowan and Ju Nuij. Over to you.
Hello everybody, my name is Jill Noy and I'm a carer awareness and voice coordinator for Caring Together. Next slide please. Okay, Caring Together. So we are a charity and we operate throughout Cambridgeshire, Peterborough and Norfolk. We provide information, we run services in the local community, but we also campaign so that carers have choices. It's really important for us to know that carers know where to go for support before, during and after their caring role, so they get the support that they need. So that's just some background around Caring Together. Next slide, please. So we are working within Cambridgeshire and Peterborough on this project. So we're working with the Gypsy, Roma and Traveller community. We know that this community have had some barriers in access and support for carers. So that's why we're working with this group. Next slide, please. Okay, so what we found in phase 1 was that the community had really strong relationships with the link workers from the county council, so we knew that was going to be the best way that we were able to reach this community and offer the support available. We wanted to ensure that the link workers were informed of our temporary support available, so that's things such as bursaries. They were aware of Caring Together and other support agencies, but they weren't always up to date on the things that we were offering that would really benefit the carers within that community. We found that low literacy levels really was a barrier to accessing some of our information, so it was suggested that easy read materials would be really beneficial. We also have support around emergency planning for carers, but what we found was that when we went to register carers from this community, that we had a barrier in terms of them leaving their personal details with us. So what we're looking at doing is creating a family emergency plan. So should an emergency arrive, all the information is available to them that they've put together and that the link worker would have supported them with, so they know where to go for support. So they don't have to give their information to any third parties. Okay, next slide, please. Okay, so what we're hoping to achieve from this is by increasing our relationships with the link workers, which is going really well. We've got some real positive relationships going. We want to buddy up with the link workers and other key stakeholders for outreach opportunities, and that's happening by we're running a workshop that's coming up in December, where we're hoping to have everybody around a table. So that will be really kind of creating those links and ensuring that they're aware of everything that not only we provide, but other agencies provide for carers as well. We want to co-produce the family emergency plan template, so we're looking at working with other agencies on this. This will be something that we will start to introduce at our workshop, and we will kind of get a guide of what is really needed, but getting that feedback from the community as to actually what information they would want stored on there and how they would want that to look. We want to help establish the Health Equalities Network. Again, that's something we're doing in partnership. We are looking to make sure that the information we're providing is accessible. So what we found in phase 1 was that they wanted easy read materials. So that's something we're looking to produce. But we also found that working with the Roma community, that there's a language barrier as well. So we're looking at other languages that they feel they would want information translated into. But also what we found is that they would want the information translated by the community, because it's not just the language. There's sometimes difficulties with different words as well. So we're looking at actually using that community to translate it themselves, obviously with our support. So by doing that as well, we also found that it wasn't just our information they needed. So we want to also provide other information from other agencies that can support carers. So it will be ourselves and other support that's available. So it will hopefully be able to reach more people and have a greater impact on there as well. We felt that by working together, that was going to be more useful. And we just want to continue working to understand the changes that are required to make the services accessible, and that's moving forward as well. So hopefully, if we can really understand the barriers and how we can make those changes and co-produce, that will lead to improved health and wellbeing outcomes for that community. If they're engaging in the support services, hopefully that will have a greater impact on their health and wellbeing. Okay, next slide, please. Okay, so that leads me to any questions.
Thank you, Jill. Is there any questions for Jill? I think we're far ahead of time, so we've got enough time to take any questions that you might have. We've got a hand up. I think that's Chris. Hi, Chris. Are you there, Chris?
Sorry, my microphone went off again. Yeah, good morning, everyone. A really good presentation so far. That was really interesting, Jill. How do you find it amongst the traveller and Romani community with people identifying as carers?
Yeah, that has been a real barrier, and actually the word carer isn't always recognised within the community. So when we're producing the easy read and the translated documents, that's something that we're really looking at how we word how we word the documents, really, to kind of work around the word carer, because it isn't always sort of understood, and we have had real barriers in people sort of identifying as a carer. Absolutely.
And does the cared for person also identify as somebody who needs help as well? Is that another barrier?
Yeah, that can also be a barrier. And within the communities, it's kind of that's just what we do. And when we found that some people like, oh yes, I am caring, but then when we go forward to gain the next support, it's like, oh no, I don't want anyone coming in. I don't, that's kind of the barrier as well. So even if we get past the first hurdle of actually identification, it's actually accepting the support as well.
Mm.
Yeah.
I mean, just as a general comment, colleagues, I think this could be an issue which sort of like goes through quite a few of our projects. You know, within specific communities, you know, people identifying as carers in the way we would define it, and also for the cared for person as well. Thank you.
Yeah, thank you.
Cheers.
Thank you.
Thanks, Chris.
The root barrier.
Yeah, I think this highlights the importance of us having these learn and share events with Just the Site, because it's an opportunity for you guys to share the learnings in terms of, like what we've just said, Jill, on how you can break those barriers in terms of getting the carers involved, especially from those difficult communities, because it's not really easy for them to trust people of authority, especially from NHS or any other sort of like official organization. So it is important for us to sort of help each other and share best practices, really. Any more questions for Gio? Silence is golden. All right. If no more any more questions in the chat box? I don't see. No. We can move on to the next presentation, which is Sam Palmer and Paul Johnston, Greater Manchester and Gaydham. Can you see us LGBTQ plus carers project? Over to you, Sam.
Okay, thanks, Steve. Hi everyone, my name's Sam Palmer. I work for Gaydham, which is a charity in Greater Manchester, and I'm going to talk to you today about our LGBTQ plus carers network, which is our new name for our project. Next slide, please. So I'm just going to give you a really quick introduction for anyone who doesn't know about the project, and then I'm going to hand over to Keisha, who's our project worker, who is part of the stage 2 funding that we asked for. So we put in an application to recruit a 7-hour post to continue to grow and develop the project. So Keisha will tell you a little bit more about her work. Just quickly about the background. So the project is supported by Manchester Health and Care Commissioning, and we've got Paul Johnson here today as well, who supports it. And it's in partnership with the LGBT Foundation and myself, Gaydham. We're all based in Manchester. The idea was basically around, I'm a LGBT carer, and when I started working at Gaydham, I was surprised that there was nothing around for carers from that community. So we did a bit of a shout out. We started to kind of get work in partnership with the foundation, and we delivered some events and some training, and then we were lucky enough to get stage 1 NHS Mind the Gap funding to set up kind of an advisory group of LGBTQ plus carers to help us do a survey and to kind of create a group, and then we did an evaluation and a report all co-productively with the carers, and then the report was produced, and hopefully everyone's had a copy. If you haven't, just give us a shout, we'll send one over. And what we found is the group were really enjoying meeting and kind of created a really great online group that's continued to meet. So we applied for extra funding because we wanted to be able to continue that and to grow it. If you just go back a minute, Steve. Yeah, so just like I said, that's the partners, and I'm just going to hand over to Keisha, who's going to tell you about the kind of future of the group and what we're planning to do with stage 2 funding. Keisha?
That's great, thanks Sam. Hi everyone, as Sam said, I'm Keisha. I work for Gaydham and I am the project worker for this project. I'm just going to talk you through where we're at and where we're going with the network, basically. If I could have the next slide, please. Thank you. So I'll talk about this in more detail on the next slides, but this is a bit of an overview of where we're at with the project. So we've done a consultation with the existing group members. So that was the advisory panel from before who helped produce the report. And this was very much on how they want the group to be moving forward, structure, branding, etc. We've looked at promotion and recruitment. So that was creating promotional materials and then growing the group, basically. Next was to look at consulting with the group again on the development of LGBTQ plus carers awareness training to deliver to professionals and organisations. So we're up to the stage where we've consulted with the group and we've agreed learning outcomes for that. So moving forward, we're looking at developing that content and then delivering it to professionals. Next slide, please. So this is some of our new snazzy branding. So it was decided with the group that actually they wanted, well, they decided everything, the name LGBTQ plus Carers Network to give a real identity to the group. The branding is actually from the report from phase 1. So the group really wanted to keep that theme and be identified with that report as well. And that's just some information we use on our various posters and social media campaigns. Next slide, please. So in terms of consulting with the group, the structure, obviously I've mentioned the name. We decided specifics for when and where we'd meet. And that was really based on feedback from carers that they needed something that was scheduled in to their diaries that they could attend consistently if possible, and also to help with recruitment for the group as well. We looked at online and in person, and in terms of the structure and what carers wanted for the group, it's going to be a mixture of informal socialising, kind of chatting and checking in, some project focused work, so that would be the training, for example, and then also some more themed meetings on whatever the carers would like to discuss, and from that we might get a guest speaker in, and of course the overwhelming vote was for socials as well, so we're looking at getting the first one for November. In terms of promotion and recruitment, we've made links with regional and national carers services. So that's getting us out on social media, in various newsletters. We've had a lot of interest so far. One thing we have found from this recruitment, even though it's early days, is for LGBTQ plus carers, they are weary of coming to the group. And there are some issues around maybe having newly come out and not knowing what to expect from the group, or have never been in a community-based group like this before. So one thing we're looking at implementing is kind of a buddy up system. So there's the chance for an informal chat with myself before, or actually with a member of the group, just to get that informal feel of what it's all about. Next slide, please. So this is around the carer awareness training that's going to be developed and delivered to professionals. So from our last meeting, we did a consultation with the group and agreed the learning outcomes for the training. And they are around being more knowledgeable about carers and LGBTQ plus identities, understanding healthcare inequalities and caring challenges. So this one was very much around carers wanted to identify almost a double challenge of identifying as LGBTQ plus and of caring and how they intersect. Learning outcome 3 was really important to share actual carers' experiences and how we do that. And then learning outcome 4 was in consultation with professionals and organisation input as well, over what staff feel they would need to support LGBTQ plus carers. Next slide, please. Yes, so in terms of opportunities, we do have promotional posters and materials. So if anyone would like them to share our group details with carers and their networks, because we are meeting online at the moment, there is the opportunity. We're based in Manchester, but that doesn't mean that the carers have to be based in Manchester, so it is open to all. And then also there's the opportunity to sign up and to receive our training when we've developed it. Next slide, please. That's everything, so thank you if there is any questions.
Thank you both. We've got a question from Shanna.
Oh, can I just say this is incredible? I literally was loving everything that you were talking about. I run the local LGBTQ group for autistic people in Bedfordshire and MK, and I know that so many of them would get so much out of this. So it's just amazing. Like, I'm really excited to kind of look through it and maybe send some adults your way that would really benefit from attending. So it was really great. Thank you.
I think we've got Elaine with her hand up as well.
Hi, yeah. It was just a couple of things really. So we provide carer services across the north. One of our contracts that we work is with Staffordshire, and we've got a small pilot project going on with their LGBTQ plus groups, very early start-up that we've given some funding to kind of launch something across Staffordshire. I'm just wondering, because they're an early start-up, would it be worth us linking them to you? I'm sure that there's probably lots of learning and expertise that they can get from you for their early phase.
Yeah, definitely. Just to say as well, I don't know if we mentioned it, but we met with Wandsworth carers who run a similar group, and we're starting to talk about doing a network in terms of professionals and doing sharing good practice and sharing what we're doing. So yeah, definitely tell them to get in touch.
Brilliant, thank you. And then just one other thing. So are you across the whole of Greater Manchester? So we've got a couple of other contracts in the Greater Manchester area that I think we could signpost some carers to you to get involved, if that's
the group started off as Greater Manchester, but it's grew and we're open to any carers coming from across the UK. In terms of supporting carers, we do some areas of Greater Manchester, but if it's not us, we've got links with partners so we can signpost.
Brilliant, thank you.
All right.
We've got Hazel. Hazel, you've got your hand up.
Yeah, thanks very much. I popped a question in the chat, which you've come back and said that the group's open for, but I was just curious in terms of, and this might be more about what came out of phase one, but have you, as part of that research, did you identify any very specific issues around older carers who are LGBT plus, in the sense of, you know, they may have lived their entire adult life without coming out to anybody and still feel that's a stigma attached to that? I'm just wondering what, if anything, if any research brought any more of that voice of those carers out that we can hear about and then consider responses and approaches.
Yeah, so we noticed that there was kind of a limit in terms of ages of people attending. So we did get quite a good mix, but it kind of stopped at like the 50 kind of age. And from some discussions that we'd had with some of our older carers is what's being already raised today is that fear of online and not being able to access services or not feeling comfortable to access things online, which is why we're looking at doing more face-to-face groups where we're going to possibly target older age carers and do walks and events where we feel like they might participate. The kind of one of the biggest things that came out the most was the need for some kind of advocacy, and whether that's through the carers service or whether that's separate. Is a lot of the carers were saying that they just get exhausted kind of fighting as a carer for the rights as a carer, but also the additional difficulties or challenges that come with being LGBTQ and having to battle homophobia or transphobia, and sometimes they're just not wanting to do that, but really looking for someone to do that on their behalf. And also kind of the looking for allies within services. So they say that they look for signs that they're kind of a friend of them or an ally. So that might be simple things like using pronouns, the colours, the photographs that we use. So simple things like that where they feel like they'll be comfortable to come out to the service that they're asking for support with.
That's fun. That's fascinating to hear, Sam. Getting really thought-provoking. Thanks.
Just conscious of time, are there any more questions? No hands. Okay, thanks to Sam and Keisha. I see, Sam, you've put Keisha's email in the chat box for people looking for the posters and the report. Please do email Keisha. The email is in the chat box. Thank you. we'll move on to the next presentation, which is bridging transitions from young carers to adult carer, which is the North East and North Cumbria ICS. We've got Beth Major and Lee O'Brien.
Hiya, I'm Beth Major. I'm the CEO of the Junction Foundation. Unfortunately, Lee from Carers Together wasn't able to make today, so I'm it for for our project. I suppose it's useful to have the context of where the project came from, which I'll do for the first little bit of the presentation. And our project focused around transitions really and young adult carers. And phase 2 was around the development of a transitions passport for young adult carers within South Tees. Next slide, please, Steve. So in phase 1, we chose a project around young adult carers, where the commissioned service for young carers across South Tees, and Carers Together is our adult carers service within the local area. And we did this for a number of reasons, really. The first being disengagement of young adult carers, that kind of, you know, gradual disengagement from young carers services in the run up to 18. And then locally, our kind of information told us that they generally don't drift into adult services until kind of their mid-20s, and we didn't know if that was a choice, that kind of phase of life where you think you can take on everything, or because of the services that were available. Our kind of local knowledge around some of the disconnect between child and adult services and the systemic issues with transitioning between child and adult services, a lack of data on needs, and the opportunity for co-production with the young adult carers and as two services, trying to get our heads around what the configuration of services needed to be to better provide for this kind of age group, really. Next slide, please, Steve. So in phase 1, we asked the question, what would help young adult carers to make a successful transition to adulthood, and we used a participatory appraisal process to inform that co-production. Next slide. Conscious it was a very detailed project, but we haven't got time to go into it in much detail. The answer that the young adult carers came up with really was a specific project for young adult carers aged 15 to 25 who have shared experiences of living through a range of transitions, whether that's sort of entry to further education, training, employment, whether that is around health needs, whether that is around the changing nature of caring needs as young people transition into adulthood, really, and the changing expectations on the young people. So next slide, please, Steve. So that kind of, we did some work around what that service may look like. And in some ways, what they were asking for was a kind of whole bespoke service. Some of the elements of which are detailed there. And one of the key things that they highlighted was work with education, health and social care services to identify and flag young adult carers. And that was based around the sometimes lack of awareness of the need of carers within various services. The young adult carers really talked about their wish to stop retelling their story as well, and highlighted a young carer's passport as a way of doing that, and also as a way of brokering that specialist support around their transitions and their particular needs. Next slide, please, Steve. So the result of phase 1 actually influenced wider provision within South Tees area. It happened at quite an opportune time for us, really. in that both the young carers service and the adult carers service was being recommissioned over this period of time, and commissioners were really open to hearing from the experiences of carers from all ages and using those kinds of that information to reshape the tender. So the tender came out kind of over the summer period, and they've reformed it as a South Tees all age carers service, and a part of that is a transition service that needs to be co-delivered by the adult and children's service specialists. So for all it is within the initial budget scope, so there's not a huge amount of resource for that, there actually has been a changed emphasis through the original work of phase 1 within the tender to be able to meet those needs, which is a real positive. Phase 2 of the Mind the Gap project offered the opportunity to respond to the wish to see real change within a controllable resource for us, because I think both kind of through our own co-production work with young adult carers and through the kind of independent evaluation conducted by the university, the thing that came across really strongly from the young adult carers groups that were involved in both phases of the initial research was, we want to see some tangible real change. And we were certainly invested in that as a service. So as part of the focus of our phase 2 project was around the co-production of a transitions passport, as this was seen to be the part of the recommendations that at that time was within our gift. You know, it was something we were able to do and embed within services to create that real change that was wanted by young adult carers. Next slide, please, Steve. So, and apologies, Steve, this is part of why our slides were so late in coming. The young people got from the original kind of focus group within phase 1 got together and with the support of staff from both projects to work on organising a day to involve a wider set of young adult carers in co-producing the passport, and that only happened over October half term because a lot of the young people are busy at school, college, etc., during term time. So we held an event in Middlesbrough for young adult carers to do a workshop, essentially to look at the passport. We are really keen that the passport is the young people, young adults document, and as such we wanted them to really work on designing what should go in it and what the focus needed to be, and using the research from the original phase to inform that, so there was a wider representation of views. Next slide, please, Steve. So we're now in the process of, we've had the feedback from young adult carers. They want to focus on journeys rather than stories. They like the idea of kind of the suggestion of a journey throughout the passport. They've talked about content, detail and current transitions, future plans, aspirations, interests and strengths. They wanted it to be an empowering document that doesn't just talk about problems, that talks about solutions, strengths and current capacity. Barriers related to their caring role, linked to progression, the emotional impact of their caring role and whether that may need some support within whatever settings they choose to present to professionals, practical and financial barriers, access to services, and including identification of what support would help from which agencies. The idea being that they themselves are empowered to provide that information, but also, if necessary, support workers can advocate on their behalf. and a particular focus around transitions within education, training and placements and employment settings, because our findings from the first phase was that on occasion it's about miscommunication with these settings that prove to be barriers to young adult carers. You know, we have talked to we have supported as a service ourselves young people through situations where, for example, they've had bursaries that have made attendance at further education possible taken off them because of attendance rate, but that attendance rate has been linked to their caring role. And so some of it is about having that information about people's circumstances in the first place, so those situations never really happen. Next slide, please, Steve. So the passport has been taken to the South Tees Carers Forum, which is linked into our Health and Wellbeing Board, because part of the success of the passport is going to be around the support that we have from health, education and other providers that are involved in young adult carers' lives, really. For adoption in principle, we've kind of done the introduction and the feedback into that on the 3rd of November. To encourage adoption, buy-in and use from a wider range of professionals, and feedback from that group can be incorporated into the final design. In principle, we gained their approval, obviously subject to the final document once it's ready, going back up for approval. Could I have the next slide, please, Steve?
You've got to be quick. Time.
Yeah, I'll be really quick. So we have had approval. The work left to do is we need to get feedback from professionals and then get that approved from the young adult carers as it is their document. They are looking at marketing and branding for the passport and the new service. We're looking to get the final adoption and approval from the South Tees carers, and then the young adult carers will lead on the rollout and buy-in within training sessions for education, training, employment, health and child and adult services. That was as quick as I could make it, Steve. Thank you.
Cheers, Beth. Thank you very much. If you've got any questions, please hold on to them or put them in the chat box and we'll be able to pick them up later. And we can send them. I think, Beth, you're going to leave a little bit earlier today, aren't you? So yeah. I can always send them and we can always respond to people. I will move on to the next presentation, which is Connecting Carers Made Through Addictions. This is the first of the scoping work for the sites that will be coming on after the break. So this is the first one. It's Lancashire and South Cumbria. Leanne, are you online?
Yes, I am. Thank you. Is it possible for me to share my own slides? Just because I only found out this morning, and I've made some adjustments to this presentation to be suitable.
That's fine. Yeah.
Wonderful. Thank you. Saves you having to move the slides along as well.
It's all right.
There we go. Is that showing up?
Yeah.
Wonderful. Morning, everyone. My name is Leanne Scott, and I'm here representing Carer Connect in conjunction with Carer Support South Lakes. And like I said a moment ago, this has kind of sprung on me, so I hope I've got the tone right. And please, I'm open to questions, but this is kind of a bit of an overview of what we've been working on. So Carer Connect is about when lockdown happened, everyone felt isolated, carers and everybody else. And we came together to kind of look at how do we counteract that. And we focused very much on Cumbria to start with, but we would like to take this into a much wider community. But today I'm going to really talk about Cumbria and how we bring carers together. our goal is to bring carers together and give us an opportunity to care for the carers. They're doing all the hard work in terms of looking after their family members and the people that they care for, but how can we support them? So we were doing this in conjunction with The Well. We have built the platform and we're still implementing The Well as part of the program. So I'm going to give you an overview of what we've done and where we're going with it. So we are still scoping, as I said. The Well's vision is for people facing severe and complex social exclusion to have the opportunity to live healthy and fulfilling lives. And we believe that the way to do that is to really embed a social integration and social connection as part of the program, which is why we within Carer Connect and The Well have come together so well. No pun intended. The Well do things in kind of 5 very specific ways. They believe that recovery is infectious, and we believe that connecting with people is a way to kind of help people on their journey through recovery. So that's really the point that we've focused on. So we're meeting people where they are, and we're helping to take care of the carers. So what is Carer Connect exactly? It's a community platform. Everybody's seen the social platforms, Facebook, LinkedIn, and that, but this is focused specifically on carers. And I've skipped a slide, so I'm just going to go back. What we're trying to do is look at ways that we reduce isolation, we increase that connection, and be proactive in monitoring. I believe very strongly that people have a digital body language, and if you can start being proactive and looking for those signals, we're able to help them before they maybe spiral out of control. We can signpost to resources. We can increase awareness about what resources and facilities and help is available. A large part of what we want to do is encourage self-service. And by doing that, we're able to kind of better use resources. So instead of answering the same questions over and over again or highlighting events that are coming up, we're able to allow people to take back control of their time, but also make sure that the resources that we do have available are for the really important things that need a human interaction. So what has Carer Connect got in it? So it worked. One moment. Oh, Steve, maybe I should let you do the slides. Sorry, it's just frozen. There we go. It's going the wrong way. I'm so sorry. It's pushing it. There we go. Apologies. So what we have inside on the platform is a news feed and activities. So we know that some people just like to observe or lurk, and so we allow a conversation to start happening. And what we've seen is as people start to see what's happening, they will hop in, and they might start off just with liking a comment, but at some point they will actually jump in and join the conversation. But they're still learning. It's that social learning, that social collaboration that we're able to encourage in a way that if we were only dependent on face-to-face interactions, we wouldn't be able to really emulate. There's support groups specifically. So we have a support group specifically for addiction, and The Well will be facilitating that group. So people can come in there. It's a private, safe space. They can come in and actually ask very specific questions and get feedback. We look at wellness groups. We've got forums with ongoing information. We have access to partners who can help, like The Well. And a really important thing is that they're able to meet other carers who are going through the same thing. And I'm going to show you a great example of that. And we can run events within the platform through Zoom. It's integrated. So we've had a very successful uptake from the men's group, which was unexpected, as well as the dementia group, and then we run virtual coffee mornings. Another great way that we can use it is quiz nights, just social events to get people interacting. So this is just a bit more detail of what's inside. Everyone's welcome to look at this, ask the slides afterwards. And what we're really trying to do, and I hope that's kind of really coming across, is that we're closing the loop. We're connecting carers, but we're not only connecting carers with carers, we're connecting them with support organisations. We can connect the teams and the volunteers, giving them their own space to keep the teams updated, as well as helping to guide their interactions. Paid carers are a great resource to add on here because they are talking to family members and they're able to share what we're offering, what we're doing, and as part of that signposting awareness kind of piece that we're working on. Support organisations and then product suppliers. And so our big goal is to empower carers to self-serve, as well as raise awareness about what help is available. I think that's been maybe one of the biggest barriers, is people don't know where to turn to when they need it. So here's some examples of signposting. Christine asked, can somebody tell me if there is a meetup for carers in South Lakes? Thanks. And we were able to go back really quickly and say, yep, there's an event on the 29th of September, 27th of October, 24th of November, etc. As well as you can see a great picture here of one of the successful groups, and this was in the dementia group. So this was a previous meeting, and we had really good feedback, and people are very quiet to start, but they do then join in. And this was a really, really heartwarming message because it showed that what we were doing is really working. So Catherine came and asked within the parent carers support group, my daughter in her 40s lives with me. I would very much like to connect in person with others. I live in Kendall. Nikki pointed her in the right direction. And then Wendy wrote, also in the parents group a little bit earlier, how do you deal with bad language and abusive name calling from your daughter or son when you've been caring, living and helping for 30 years plus? I struggle with my 37-year-old daughter with a late diagnosis of autism. She suffers loads of mental health, anxieties, depression, suicidal thoughts and intentions going on. I'm based in Carnforth. If there are any other carers who wish to meet up, please contact me. I'm at breaking point and struggling to have a life, and I'm nearly 70 and exhausted. And Fran came back really quickly and said, hi, Wendy, I'm sorry to hear what you're going through as a carer. I'm in a similar situation with my son. Unfortunately, I'm not able to meet up in person, but would be happy to chat with you on the phone. Let me know. And they went on and actually exchanged numbers and arranged a time to talk. And that for us is exactly what Carer Connect is about. And tapping into the Wells philosophy of recovery is infectious, and they only use people who are recovering themselves or have recovered themselves. This is a great way to share that knowledge, to show that support, and it really warmed our hearts because it shows that what we're doing is really working. So ultimately what we're doing is we're building a community around specific situations, so whether it's Alzheimer's or dementia or addiction. And the way we can do that is we can use email invites. So we invite existing carers within our organizations. We allow the carers to invite people as well. Now, all the information is GDPR protected, so we don't have any issues with that, but what we're able to do is tap into that groupthink and really, everybody wants a viral post on Facebook, for instance, and this is a way for us to build that ripple out. We engage new members as they arrive, so we help them feel comfortable, and we interact with their posts, and we encourage them to interact. So we have a great nurturing campaign that goes out when they join to show them how things work and encourage them to participate. So we had, yes.
I'm just conscious of time.
No problem.
Are you about to wrap it up?
I am.
Okay.
So just to give you very quick, 28 groups we already have. The Well Caring for Addiction is one of them. And we just want to check virtual, I've already said. So I think that just gives you a little bit of a insight of what it looks like inside the platform and the different ways to get involved. We run events, so if you've got events that you want to let people know about, if you think there's information you'd like to share, if you'd like to run a group, we're able to do that. And of course, we want everybody to talk about Carer Connect. And there we go.
Thank you, Leanne. Sorry, we just ran out of time there. If people have got questions, put them in the chat box, please. And during the break, hopefully Leanne will be able to pick them up. And Leanne, if you can also, if possible, you can share the link to the resources as well, like you've mentioned. I think that will be very helpful.
I will do. Thank you.
Thank you. We've got a break now. If we can come back after at 11:05, please. And we can continue with the scoping projects. Thank you.
Thank you very much.
Cheers. Are we all back? Or are we still waiting for a few more people? We'll just have a look. Okay, we'll move on to our next presentation, which is caring to recovery. Is caring for someone with a drug and alcohol dependence. That's the Humber Coast and Vale. We've got Michelle Smith. Michelle, are you online?
I am, yes. I think,
yeah.
Gary, are you going to do the introduction?
Yeah, I'm online as well. So hi all, certainly some very useful presentations this morning. I'm literally just going to give a little bit of background. So I'm Gary Sainty, I'm the VCSE Programme Director at Humber Coast and Vale. And effectively what that means is we're trying to connect the voluntary sector up to the health and care system across Humber Coast and Vale. And that's where this programme sat with for us. Carers sits within our community collaborative in a system level. And I represent on that and connect the VCSE sector to it. So when this opportunity came up around the Mind the Gap funding, we saw interest from across the 6 different places of Humber Coast and Vale. And York Carers Centre were those that were particularly interested. So we did some follow-up work with Carol, who's the CEO there, to kind of understand what it is that they were doing already and where this would fit alongside them kind of doing work to develop understanding, and that's kind of how this project came about. So we've now got Michelle, who has led on the work today and is leading on this programme, and going to share our early work with you all. So hand over to Michelle.
Thanks, Gary, and good morning, everyone. As Gary said, I'm Michelle Smith and I'm working with Carol and the team at York Carers Centre. And we're focusing on families and individuals caring for someone with alcohol and or drug dependency and finding out what they want from services. So whilst the Humber Coast and Vale Health and Care Partnership covers 6 areas in and around York, this scoping exercise will focus solely on York as a place. And throughout the project, we'll be considering local assets, existing local assets, and looking for solutions for York, in the knowledge that that will be shared more widely across the ICS, across networks in York, and also, of course, across carers support services across the UK. Next slide, please. Thank you. So why are we working with this group of carers? Well, we York Carers receive a low number of referrals from this group, and we're keen to look at why that's the case, what the barriers to identification are. So we know from our current work that carers in this group face a huge variety of barriers when coming forward for support or identifying. Stigma, fear, guilt, the usual, but also we want to explore these and the other barriers that we're discovering are out there. We know that caring for someone who's dependent on substances can have a huge impact on the whole family. And going back to that sort of point about families and people recognising themselves as carers, that's already raising its head as a really big issue. So we're talking to families about their experiences, including their own health and well-being, how their finances are affected, including employability, how their social networks are affected, and that's focusing a lot on negative and antisocial behaviours, and also the impact of the pandemic on this group of carers particularly, and their caring role. We're gathering information about what services are available at the moment, how families hear about services and support, and particularly in times of crisis, what training is available to those families, and how families and carers are involved in recovery and treatment services. So are they involved, and are they also recognised and respected as experts in their caring role? And one really key area for us is to find out how carers manage their own health and well-being, and particularly when the person they care for is in crisis. Next slide, please. So we are going to be hosting, well, we are hosting a series of focus groups, individual consultations with carers and families, and we're also speaking to drug and alcohol support services and other partners across York. Initial conversations are highlighting the real issue of absolute confidentiality. So we've had a few people who are wanting to come forward, but really concerned about protecting the person they care for's identity. And it's taking a lot of persuading to get people to come forward, because it can be so difficult to share that information and to exchange it. We're engaging with carers and families we currently work with who've been attending a monthly peer support group recently established by York Carers. But the most challenging area is actually to engage those who are not accessing any services at all. And we know there are a lot of them. So we're trying to promote the opportunity to get involved right across York by offering confidential conversations. We're sending that out in the local link, the newsletters, social networks, wherever we can, but it's proving challenging. So any help that anybody's got on that would be really welcome. We're also engaging with local partner services, so not just substance misuse services, but also other partners to understand their perception of carers. And we've got a big event happening on the 6th of December, where we've got everybody coming together and hope to get a lot of information from them. And also just to see how they can work more closely with carers and improve outcomes for those who are caring for someone who has a dependency. Next slide, please. So as I said before, confidentiality is a real issue. So co-production has been challenging in a way, but we're really conscious of the importance of co-production. And Carlotta is one of our carers, and she's a filmmaker. So she's been spending time with her peers, working with them to share their journeys and their stories. And this will result in a film and clips that will help to share the learning as part of the project. She's confident in telling her own story, and so therefore she's encouraging others to do the same and providing a really safe setting to do that. That's working really well at the moment. So she's going to produce edited short film clips probably with hidden identities, and that will illustrate carers' responses to questions around the stigma that they face, how and if they look after their own health, whether they identify with the term carer, their understanding of addiction treatment and recovery, and what would help them better to understand that. And also their experience of addiction services in relation to recognising carers as experts and integrating them in plans for treatment, addiction and recovery. Next slide, please. So what are we wanting to get to? Well, we want to explore what carers and families want and need from services that will support their caring role. How best carers can advocate for themselves and promote their own health and well-being, and how can they get more involved in supporting the person they care for through treatment and recovery. Throughout all of this, we're bearing in mind the importance of co-production in developing recommendations, and the final report will be put into a draft format, but then will be edited by the carers who've been involved, and we want to ensure that the report really reflects their perspectives, and also that we finish up with their recommendations rather than ours. So I just want to thank everybody for the opportunity to share this, and happy to speak to anybody outside of this if there's some sharing to be done to make things easier for us all. Thank you.
Thank you, Michelle. Really appreciate it. I think, like what you've just said, today it's an opportunity to link up with other sites that are doing this sort of similar work to yourselves, so you can learn from each other. I think the last project, which was from a presentation from Leanne, the Connecting Carers Made Through Addictions, that could be another sort of connection that you could make, and see how you can share ideas.
Yes, thank you.
Yeah, so we can sort of like share your emails in the chat box as we go. Thank you. Any questions at all for Michelle? I think you're getting away lightly with this one, Michelle and Gary. All right, we'll move on to the next presentation, which is Hidden Carers Early Identification Project. We've got Elaine Jones from Greater Manchester and Social Care Partnership.
Morning. So my name is Elaine Jones. I am the head of service for carers with Encompass, and our project was around early identification of hidden carers. Next slide, please. So for this project, we looked at our Rochdale Carers Hub service. We've kind of done some early work in terms of that links to this project that we were hoping to build on. So our Rochdale Carers Hub provides like a single point of access for all carers of all ages. And we are there to make sure that carers get access to information, advice and guidance and have an opportunity to kind of take a break from their caring role. And the support from Rochdale Carers Hub ranges from kind of like really early support to more intensive one-to-one and group support. Overall, Rochdale Carers Hub is delivered by Encompass. Next slide, please. So Encompass are an organisation that operates across the north of England, and we started in 1999 initially as an advocacy service in Lancashire, and since that time we've grown considerably. So we cover kind of 6 areas now, and in terms of our carers service, we operate from Carlisle down to Staffordshire. Encompass is an organisation that not only supports carers, but we also deliver advocacy, health and wellbeing, counselling, volunteering opportunities. But obviously for the purpose of this, carers is our main focus. Next slide, please. So initially when we started to look at the possibility of doing a piece of work and a project with Mind the Gap, I went back and looked at kind of some of the data that we had around carers, specifically in Rochdale, and kind of the census data, which I know is really out of date now, kind of showed that around 10.6% of the population of Rochdale would describe themselves as carers. And I then went and took a bit of a dive into the data held by the CQC in terms of GP practices and noticed that there was quite a disparity between the number of carers that seem to be registered with GP practices and the number of carers that actually would be in place across the borough. Next slide, please. So in terms of that data, and knowing that we'd already carried out a piece of work in Rochdale Carers Hub last year around a pilot project working with GP practices, I wanted us to be able to build on that piece of work to try and strengthen that a little bit more. And then looking at like more recent data, we've got some data from behind closed doors, which says that 50% of carers have seen their physical health impacted, 64% have seen their mental health being impacted. And in terms of the outcomes that we got from our initial project, you can see that the outcomes were really positive in terms of how many times carers went back and visited their GP for either their mental health or their physical health. So being able to kind of counteract to a degree the impact that carers were currently experiencing by using a project that linked with GPs was really important, and we wanted to be able to continue to build on that. Next slide, please. So in terms of the delivering the project itself, so really what we wanted to do and what we understand is we don't freely have direct access to carers. So we rely on our partners to make carers known to us. And one of those obviously is primary health. We wanted to be able to maximise the opportunity for carers to identify with primary health, predominantly GP practices. And in terms of increasing the identification of carers, we felt that kind of linking in with the GP practices was really important because they had access to carers with protected characteristics. So we haven't specifically focused on one protected characteristics. We're looking at the kinds of carers holistically across the board. We knew that in terms of working with GPs, what we needed to do was kind of really do a piece of work directly with the GP practice staff, linking them into the quality markers and peer reviews so that beyond the project, they were able to continue with the support for carers and identifying hidden carers. Next, please. So in terms of delivering the project then, so we have chosen to deliver the project in 2 phases. So phase 1 really focuses on the work with the GPs and the practice staff teams by offering them training sessions. And we kind of kept our numbers realistic in terms of GP practices, so looking at working between 4 and 6. We have asked each of the GP practices to nominate a carer champion that we will take forward to work with us in phase 2. And our phase 2, which begins in January next year, is really about consulting with those carers that have been identified through phase 1. And really trying to track the journey of a person to acknowledging themselves or self-identifying as a carer. So how did they get from being a carer to getting to the point of being self-identifying as a carer? And then what intrinsic barriers they kind of put in their way before they were able to self-identify. So was it about perception? Was it about knowledge? So really kind of working on that consultation in phase 2. Next slide, please. So in terms of collaboration working, so our phase 1 is really working in collaboration with the GP practices. So looking at what do they need from us, what can we deliver them, what skills and expertise can we share with them, so that it makes it easier for them to have conversations with potential carers. We've kind of linking in with our ICS, because if there's barriers that we need to break down, and trying to get GPs on board initially was a little bit of a challenge, but also celebrating our successes as well and really helping to share kind of the positive impact of this project. And then again, like phase 2, so really working in collaboration with carers, so them designing the materials as a result of this work that really looks at a key indicator system, which at what points carers are more likely to be able to self-identify, what opportunities do we need to be able to give them. Next slide, please. And then in terms of the learning that we're hoping to gain from the project is really looking at barriers to self-identifying. So at what point do carers feel that they would have been more open to disclosing that they were a carer and kind of coming forward and talking to their GPs. We want carers to be able to help us to improve and extend our offer to carers. So what additional resources do we need to be able to provide, and how do we provide it? And then a lot around clarifying unknowns in terms of these key indicator moments, so the opportunities for early identification, whether that was through their GP or their pharmacy or appointments or kind of various stages through that journey. And then really looking at recommendations from carers about how we continue to develop services that really meet their needs and allow them to come forward and identify. And then throughout all of that, beyond the project, we're hoping that we will eventually end up with a set of materials that we can distribute across all the GPs that will really look at kind of early kind of indicator systems. So at what point do you kind of see somebody coming into your practice, or maybe observe something that makes the staff member think, oh, this might be a carer, and open up those conversations and discussions. So there's quite a bit of learning that we're hoping to get from the project. And I think that's me all done. If there's any questions.
Thank you, Elaine. Any questions at all for Elaine? I'll just second what Jack has just mentioned in the chat box to say it is impressive that you've managed to get the commitment from GPs to do the work, which is really good, because as we all know, it's quite difficult to get them on board. So well done.
Thank you.
Any more questions? Oh, just clapping hands, sorry. Any more questions for Elaine before we move on? If you do think of any, please put them in the chat box. Thank you. We'll move on to our next presentation, which is from Bedfordshire, which is the ASD Carer Support Group for Autistic Adults Who Care. And this is Shanna Rain. Shanna, are you online?
I am.
There we go.
Lovely. So if you could just take us through to the next slide, that was just my opening slide. Thank you. So sadly, Lisa can't join us today. I'm afraid Lisa doesn't work on Wednesdays. She actually is a counsellor part-time, so she's unable to move her set up appointments that she already has. But I really wanted to make it clear that Lisa's been part of this and not kind of remove her from this process, because she has been kind of leading the groups that we've been doing. So I've just also realised I got my job title wrong, so it's going very well already. So my name is Shanna. I work for an organisation called Autism Bedfordshire. Some of you may or may not have known us, but as an organisation, we set out to support the autistic community. So anyone basically from the age of diagnosis, which we'll be looking at around 2 onwards, is able to access our support. And we're really aimed at kind of helping people socialise in the world that doesn't feel quite right. So we deliver that through employment support, skills development sessions, parents training, parent support sessions. We have a carers group, but we also have a helpline. So if we could just kind of move on to next slide. Does that look funny to everybody else as well?
Yes, it does.
Yes, it does. Yeah.
Okay. That's going to throw me, but that's not a problem. So during the pandemic, and actually to be fair, just before the pandemic, we were starting to get more and more helplines coming through our helpline service, and we were starting to note that a lot of the helplines that were coming through were from the adults that we support through our core services, that were carers themselves. And those kind of phone calls could be anything from the inequalities that they face when they're accessing healthcare services or local authority services. Now I've been doing a lot of work around transforming care and looking at the issues that we face, or sorry, the autistic community face when accessing services, which led me to meet Jodie, who is my lovely contact within this group, and we sat down, we had a lot of conversations about what could be done and how we can support people. And one of the things that I really wanted to explore is what support is available for autistic carers, because I think it's a massively unknown group that are carers themselves, but then they themselves also have support needs. So we really wanted to help autistic people that are carers, one, recognise that they're carers, because so many people don't recognise it. They either see it as that's my family, so that's my duty, and help them understand what support is available to them across the BLMK area. But also we wanted to support them with creating easy read resources and help them self-advocate. So when they're accessing services, they can say, actually, I do need support with this, and this is the support that I should be getting. And helping them really understand what support it is that they should be getting and how they advocate for that. Should we just move on to the next slide, because that's thrown my eyes. I don't know if it's doing it to anybody else. So how are we planning to deliver the project? So we've started delivering a series of workshops. So the first one was around helping the autistic community identify what a carer is, and what a carer looks like across all kind of areas. So the first one was held back in September. And then we kind of, when we spoke to the adults about what it is that they really wanted to get out of this and what information would be useful for them to help them move forward to make sure they were getting the right support and had the right information available to them. So the second one we did, which was the other day, which was around talking to your doctor. So many autistic carers themselves didn't realise that if they needed to let their doctor know and have it flagged on their system that they were a carer. So if they were to go into hospital, that somebody might need to get in contact and give them that support. So alongside the workshops, at the end of each one, we create an easy read document that's available for the adults to keep reaccessing, but also for anyone that needs that information that is autistic. It's been done in a way that's supportive to the adults that we support. So they've helped us produce those, and they've picked the kind of the colours that we go for, and they've picked the information that we're using within it, and then making sure they're happy with it. We're really big in kind of I want to call it group participation kind of area, but we work with the adults to make sure that it's suitable and it's what they want to see and what would be useful. But it's also about supporting those people that aren't accessing our services that might well be carers and autistic. And then once we finish those as well, we'd like to create a range of videos for adults, so they could click on it and it will take you through that information, because sometimes when you're autistic, having a bit of paper in front of you that explains things isn't enough, and actually having someone explain it to you in a video is really useful. And the videos themselves will actually be done by the autistic community, and it will be them talking to other autistic carers, explaining each individual area that we're looking at. So it launched resources, launch and shared resources for future individuals that want that support. So if we can move on to the next one. Lovely. So the reason that we're doing this is, we really want to identify who autistic carers are, what that looks like, what the barriers are, and make sure that the appropriate support is provided. Now, one of the things we're looking at is so many of the adults that we're working with that are feeding back into our groups is that they aren't getting any reasonable adjustments when they're going through like a carer's assessment. And is that because the social worker doesn't see that as a need when they're having a carer's assessment, and they're seeing that as a personal care need as opposed to the carer's assessment? But actually that needs to be applied to someone that's autistic. But we also want to make sure that they know where that support is and where they can go and get it. And whilst we aren't a carers organisation per se, we support over 3,000 carers at any one time that access our services. So we want to make sure that the adults that are autistic that act as carers know where to go, and they register with local care organisations so that they can have that peer relationship with other carers, regardless of whether they're autistic or not, but feel comfortable accessing those services, and then they know where to go to get those services. So if we could just move on to the next slide. Lovely. So I just wanted to kind of show you some of the literature that we've been preparing. So the first poster is the one that we did in collaboration with our adults about what an unpaid carer is. And then the second one is just a poster that goes out to everybody that can access our groups across BLNK. So as you can see, it was talking to your doctor. And the next one that we're doing is emergency planning, because so many autistic carers aren't made aware of what carers information and support is and what that looks like. So we're just breaking down those barriers further. And the plan is to feed this back into places like local authorities and local carers groups to make sure that they can make their services more accessible and available to everybody, because that's what we're all here to do. We want to make sure that everybody that can get support has the right information and support with them. And then if you want to just take us on to the next one, that might be it. I'm really sorry, I don't know what's happened in my presentation, but it did not look like this when I wrote it. It's got a bit messy, so apologies for that. And I've given you a very kind of quick one-stop overview of what we're delivering as the service, but this is a really exciting project for us that we've never delivered before, and really we want to understand what an unknown group of carers needs so that we can better equip everybody to support them and make sure that they're getting the right kind of support moving forwards and they can be happy within their caring role. Does anyone have any questions for me?
Thanks, Shanna. Any questions for Shanna? Please do raise your hand up or put the questions in the chat box. Thank you, Shanna. Just so conscious of time. Our next presentation, we've got Caring for Carers, the Asian Communities, What Works, and this is from Elizabeth Stanley and Jack Dacey from Greater Manchester Health and Social Care Partnership. Have we got Elizabeth on?
She's there, yes, she is. Hi, everyone.
Hi.
My name's Jack Dacey, and I'm only going to take up 20 seconds of your time because really, Elizabeth has done all the hard work here and deserves all the limelight. But just very quickly, Jack Dacey, I'm from the Greater Manchester Health and Social Care Partnership, and I work within the Adult Social Care Transformation team. And I'm lucky enough to be the project manager for our Carers programme. Carers programme is wonderful because we have a direct line and the attention of the 10 DASs in Greater Manchester, and they and they pay attention to the work that we're doing and really help us deliver it across the 10 localities. But even more than that it's really wonderful, and I'm very fortunate because we have people within our delivery group like Elizabeth, like Elaine from Encompass, and like Sam from Gaddon, who are challenging us, who are critiquing us and making sure that carer voices and carer experiences get embedded at a real grassroots level into the work that we're trying to do. Within our program, we have a particular work stream which is led by the Caribbean, the CEO for the Caribbean and African Health Network, Charles Kwaku-Adoy, and Elizabeth has been successful in receiving this funding for Mind the Gap on our own project, our own research, which is around caring experiences for the Asian community in Greater Manchester, and it's a perfect complement to the stuff that we're doing with Charles. I'm really excited to capture the learning from all three of the funding bids though that we've received in Greater Manchester. Yeah, and as I say, if I just really proud to be working with all three of these people. But at this stage, I'm going to hand over to Elizabeth, who's going to talk about all the work she's been doing.
Morning, everybody. Could we have a first slide, please, Jack? That was actually your slide, so my slides are probably going to be as good as the last one. Could we have the next slide, please, Steve? Thank you. So this but essentially what Jack was talking to, which is basically that in the Health and Social Care Partnership, there's a Carers Partnership Board, and I've been working within the Carers Agenda in Greater Manchester for about a good four or 5 years. Was involved in devolution right back in 2015. Myself, I am a parent carer. I have a disabled daughter who's 18, and I founded a social enterprise called Wraparound Partnership, and we've supported almost 2,500 families across Greater Manchester who all have children or young people with disabilities or complex needs. Prior to that, I was a SENCO assistant head at a local mainstream secondary school, but my daughter got ill, so I had to leave. I left that job. I decided to set up something that was more holistically looking at the needs of families with disabled children. So that's really where Wraparound Partnership came from. But running parallel to that, I got involved in the Greater Manchester Devolution Agenda and basically stuck my oar in where it wasn't wanted and tried to challenge people to think differently and listen to the voices of people who are living it. And I always say, if it doesn't make a difference in my living room or in my life, then you're not doing your job properly. Or your strategy is not the right one. So Greater Manchester has the Carers Partnership Board. They've been working an awful lot on all sorts of things to do with carers into employment, and there's a carers toolkit, there's carers strategies. The awareness of the needs of carers across Greater Manchester amongst statutory services is a lot higher up than it used to be, and that's to be certainly welcomed. There are 3 subgroups from the Carers Partnership Board. One is in relation to employment, the second one is in relation to parent carers, which I co-chair, and the third one is the one that Jack mentioned in relation to people from ethnic minorities, carers from ethnic minorities. Could we have the next slide, please? So way back in 2020, when the first lockdown happened, there was a little bit of funding left over, and somebody sent me an email saying, would you like to, do something with this funding? And I said, how about this? Had been playing on my mind for quite some time. I'm very involved in trying to seek out hidden voices, hidden communities, and small voluntary community groups who maybe don't have a social media presence, but actually do massive amount of work in their local areas. And I was conscious of the fact that Asian carers were often overlooked. And at that point, we'd just gone into lockdown as a country. I was struggling as a single parent with 3 children to get the basics like food, like medicine. Nobody knew really at that point what was going on and where you were going to get your help from. And I was left wondering, what about the families who are struggling normally during lockdown? So when we put this very quick bid together for this funding to do a little bit of research into the experiences of ethnic minorities during that period, it was quite shocking how some of them were literally just surviving. And the conversations that we had on the phone with or on Zoom with the carers at that point were quite depressing, very depressing, really. But the report came out with the recommendations from those conversations were that in terms of Asian carers, there was a lack of cultural awareness in the Asian community. Most caring is done by women anyway, and women within the Asian community have a very different experience in some cases. Some of the work that we've done in Oldham, for example, the Asian women are not allowed out of their houses unless they have permission from their husbands. So even if they're going to attend, small social groups at their primary school, for example, Najma, who is a lady I've worked with quite a lot in Oldham, she has to write letters for them so that they're allowed out to attend these social groups. So their lives are quite very, behind closed doors, as one of the comments was before. These are really hidden women. So when I spoke to them on the phone, there was a lot of conversations about cultural stigma attached to being a carer, and a lot of carers from the Asian community don't actually become known to statutory services until they hit crisis, because they're embarrassed essentially, and they don't want to ask for help. So there was a lot of conversations about how do we actually raise awareness about caring within the ethnic minority communities, but certainly within the Asian community more specifically. So the recommendations were there needs to be some social events and information provision for carers from similar ethnic backgrounds, and some link up across Greater Manchester from carers from Oldham, carers from Rochdale, carers from Bury and Bolton. If they're all working in isolation, there needed to be some getting together of those groups. Promoting support services in a culturally sensitive way as well. So it's not just a leaflet through the letterbox, there's a phone call, or it might be through the GP practices. I was really interested in what was happening in Rochdale in relation to that. Events to raise awareness of ethnic minority communities about the role of carers within that community. And when we talked about that in this particular project last year, it was about the influence of the faith communities, the work that was done in Bury and Bolton to ensure that people received COVID vaccines, for example, was literally the faith leaders, the community going out door to door and knocking on people's doors and saying, have you had your vaccine? And that's the level that we're talking about. It's about involving all communities in that area to make sure that carers get the support that they need and that they deserve. And I am quite focused on the influence of faith in this particular project that we're doing this year. And the other thing that came across really strongly was that when elderly people in particular, or disabled people from Asian communities need care, that the care agencies were quite often sending in males to support female Asian carers. And that just wasn't culturally appropriate, because they had to wear their hijab and they needed to know a male was coming. And you couldn't have a male carer doing personal care for an Asian female. That just wouldn't work. There was no, planning in relation to sending agency carers into those families. And the other issue, of course, was the interpretation situation, which was also quite challenging. The halal shopping support was a really interesting one, because it was something I hadn't even thought about during lockdown and pandemic. People were getting food delivered by food banks or agencies, support staff, and it wasn't halal, so they couldn't eat it. So that was something that was quite shocking that nobody has really considered. So that was the report from last year. We have got a report. If anybody wants to see it or read it, then I'm quite happy to share. Could we have the next slide, please? Okay, so I have just noticed on the presentation that I think I've just copied this slide, so the next one might be exactly the same. So from the report from 2020, in relation to this particular scoping project, it was more of a deep dive into what do we actually practically and realistically need to do. Going back to what I said at the beginning about if it doesn't make a difference in my living room, it's not working. If it doesn't make a difference in my life, it's not working. What is it that people and carers from Asian ethnic backgrounds need to help them practically? So, and I can't answer that question on my own. So it was more about getting other carers together from those backgrounds to talk about what needs to happen to help them. To understand what adjustments need to be made to encourage carers from Asian ethnic backgrounds to access support. And going to GP practice, for example, carers from Asian communities must have made themselves known to GP practices in order to get vaccines early, for example. So even though in 2011 census there was 23,000 Asian carers across Greater Manchester, it will be a lot more than that now. To co-design recommendations with carers from Asian ethnic backgrounds, I'm very much of the belief that nobody has all the answers. It's about being a collective network of people passionate about this. And the next one, to develop an Asian carers network which can become sustainable long term. So in Greater Manchester we have the Homelessness Action Network. There's quite a few action networks, and it's about bringing people together. It also including people who have support housing, who are faith leaders, who are community leaders. It's not just about the actual carers themselves. It's about bringing everybody together in that local area to develop recommendations and solutions themselves, but also to evaluate and share our learning with others. Next slide. Now, if it's the same one, I'll just skip to the next one. Yeah.
Just be quick, Elizabeth, because we're running out of time.
Yeah, that's fine. Do you want to skip to the next one? So the outcomes from this, to develop and establish a focus group of carers from Asian communities, to develop practical solutions, which is what exactly I've just said. It needs to be realistic. It might be posters for GP practices. It might be a toolkit. To discuss how services support involvement in conversations through provision of appropriate language and translation. To discuss the importance of dietary needs and faith networks, and to shape and change cultural attitudes and awareness within the Asian community. Now, that one is going to be quite tricky, but it's going to be interesting to work with the group of people that we've got together to try and tackle that. We're never going to get it 100% right, but we do need to make a start somewhere, take that first step. Next slide, please. Though I think this might be the last one. Yeah, that's it. So if you have any questions, I'll put my email address in the chat box and feel free to get in touch. Thank you, Steve, for the opportunity.
Thanks, Elizabeth. If you can also send us the 2020 report that you've just mentioned, then I can share it within the group as well.
Will do. Thank you.
Thank you. We'll move on to our next. Sorry, if you've got any questions, like what Elizabeth just said, just put questions for her in the chat box. Our next presentation, it's coming from Karen Shaw and Karen Grundy. That's the North Eastern North Cumbria ICS. And that's looking at asylum seekers and refugee carers in Stockton-on-Tees. Both Karens, are you online?
Yes, I am. It's Karen Grundy, and I'm actually going to do the presentation, and Karen Shaw will jump in as well when we need to. Can I just check you can hear me?
Yes, we can hear you fine.
Brilliant. So my name's Karen Grundy and I'm the Strategic Programmes Manager at Catalyst, which is the infrastructure organisation supporting the voluntary, community and social enterprise organisations in Stockton-on-Tees. We also manage a migration project, which is how we became involved in this one. And we're working closely with Stockton-on-Tees Borough Council and County Durham and Tees Valley Clinical Commissioning Group. Next slide, please. We know that in the general population, people caring for family or friends do not always identify with the label carer, and this might be compounded in the migrant communities due to culture and language. Not just that English might be their second language, but that the words we use, such as carer, are not recognised. My colleague is American and they don't use the word carer at all, but we'll talk about caregiving. So it's just looking at those nuances. By engaging with the refugees, asylum seekers and people from migrant communities and listening to their experiences, the project aims to find out whether there are cultural and language barriers to them, identifying as informal carers and how best to engage with and support carers from this cohort in the Borough of Stockton-on-Tees. It will consider both adults and young carers. So how will we do this? We're going to engage with refugees, asylum seekers and people from migrant communities to find out firsthand what their understanding of a carer is, through the provision of education, information and engagement with the cohort, identifying the different groups of carers and potential numbers. Because at this stage we don't have a figure at all. We're going to listen and develop an understanding of their experience of local services and involve members of this community in defining their needs and developing possible solutions. Work with relevant VCS organisations to understand the issues of identification and sort of support from different perspectives. In talking to organisations in a recent workshop, it was clear that for the majority of them, this isn't a primary focus for them. And so in fact have not even thought about it, so themselves don't know enough about identifying people that they're working with as potential carers. We want to promote the care services to this group and develop an understanding of what would ensure carers from this vulnerable communities access support so that they maintain their own well-being, whilst also identifying barriers to engagement and what matters most to them. We know that this is a hard group to reach and engage with, and so we're working with recognised community and faith leaders and RAS organisations. I think it'd be really easy for us to think that we know what the issues are and we know what the solutions should be, but we're very conscious that we don't want to make any assumptions and that we're guided by those dealing with issues on a day-to-day basis. Next slide, please. When pulling together the bid for the funding, we set up an initial steering group. As an advisory body, it's made up of senior stakeholders and experts which provide guidance and support. Members of the group include Stockton Borough Council, the CCG and Catalyst. We have mapped 23 organisations within Stockton that are working with asylum seekers, refugees and migrant communities. Since the workshop that I talked about, we've actually added 2 community leaders a VCS organisation that supports young carers, as well as a member from the Arrival Medical Practice, that's the lead GP practice for asylum seekers and refugees that have come on to our steering group. We think it's vital that we have that strong, experienced steering group to help shape the direction of the project to ensure that we achieve our objectives. And certainly our community leaders are very vocal about what we should be doing and how we should be doing it. On the 2nd of November, we had a workshop and pulled together organisations, community leaders, the local authority and health. We explored what it means to be a carer, talked about the support services available, but most importantly, identified the issues to engagement and self-identification. We're in process of pulling together all of the information for the workshop that we'll take to the steering group to look at the next steps. Next slide, please. So our timeline focuses on 4 key areas. That's about the engagement, monitoring and evaluation, analysis and feedback. We've already begun that engagement with community leaders and organisations working in the field, but we're going to continue to speak to individuals, small groups, but most importantly, be visiting their groups. And already we've got drop-in sessions that people have invited us to. Monitoring and evaluation is going to be a continuous thing, and feedback to the steering group and to those involved. And at the end of the project, we'll analyse all the information that we've gathered to write a comprehensive report with recommendations, which everybody will be involved in. It's really clear how important feedback is, feeding back to everybody involved is. We want people to feel very engaged, feel the ownership of the process, and feel that they have helped with the co-design of where we are going. Next slide, please. We know we're working with the transient population, which itself can be challenging. We have a hotel where we have significant numbers of asylum seekers who, many of them will come in for a short period of time and then be dispersed to other areas. We have a lot living in Stockton, but many will go to other areas, so that can be challenging. In Stockton, our population indicates that there would be approximately 20,000 carers, but only 4,000 of these are known to the carers services. Self-identification, as many of us have already spoken about, can be difficult. It's just something you do looking after a chronically sick child or elderly relative. For many of those that we hope to work with, we know that it's not only the language, but the culture will play a huge part, and we heard about that in the last presentation. Since January 2018, when the Stockton Adult Carer Services were established by the local authority, no referrals for carers who are refugees, asylum seekers, or migrant community or from migrant communities have been received by that service. As a transient population, we want to develop a toolbox of support and information that will be co-produced by them, but aims to offer support and information wherever those people move to. I think it would be really easy to see the success of this work being that people from these communities access the services that are out there, but it may not be the case. Again, we've heard earlier about cultures where this is very much what happens within that family. You don't ask for support. It might be frowned on that you ask for support. So what we want to know is we have done everything we can, working with the group that we've identified to support them, and accept what the outcomes of this might be. It may not be exactly what we thought it would. It's going back to that, making assumptions. We just need to know that we've tried. Next slide, please. So I have sent this presentation before we did the workshop, and what we've done here is we've put down a list of the people that are on our steering group. But as I say, we've got another set of people that I think are going to have the greatest influence to add to this group. I have put my contact details on there, and I very, very much want to get the contact details from a lot of people that have spoken today. This has been such a useful time spent, and I've been making copious notes of ideas from what you've been saying. So thank you very much, and if there are any questions.
Thank you, Karen. Have we got any questions? One or two questions that we can take? Thank you, Karen. I would also suggest, I don't know, I think we might have already done, Karen, send you links to case studies done by Dorset and Met and Menkamp from last year. Have you seen those? Okay, yeah, that's why I see it.
Thank you.
Okay. Yeah, that's fine. All right. But please, yeah, like Karen said, you know, feel free to connect with anyone in the chat box and share your contact details. If you need us to do it, just let us know as well. We'll move on to the next presentation, which is tackling inequalities in services provision for vulnerable or less ahead carers. That's within that's from the Southern Health in Hampshire and the Isle of Wight ICS. Amelia Abbott and Paula Hall.
It's just Amelia Abbott today. But thank you very much. Yeah, my name's Amelia Abbott. I'm from Southern Health NHS Foundation Trust. Next slide, please. So far in the Trust, we have a lot of different services that we aim to serve, including mental health, some physical health services, and some specialist services too, such as learning disabilities and forensics, and they're in both community and inpatient units. We also cover a very wide geographical area, so some of our communities can be in quite rural spaces, such as the New Forest. It's well worth a visit, just a little plug there. But we also have communities in our bigger cities, such as Southampton, Portsmouth, Basingstoke, etc., etc. So we cover quite a huge population, and that's always the biggest challenge when it comes to engagement as part of Southern Health, because there's so many diverse populations that we want to serve and that we need to hear the voices of. So far we've been doing a lot of work over the past 18 months to 2 years in regards to our carer engagement, both on a strategic trust-wide level, but also on a local level within services as well. So supporting our staff to work more collaboratively with carers when it comes to the best outcomes for our service users. We were recently revamping our carer strategy as part of our wider engagement strategy. And whilst reflecting on some of that really positive work, we were looking at areas that we need to improve in and areas that we need to work better with. So it was very timely that we were afforded this grant. So thank you so much. Next slide, please. So we're not just deciding to take on one community. We've kind of gone quite wide within our remit, because there are so many communities, like I say, that we need to be working with. These are the initial 5 communities that we've identified as being a huge part of Hampshire's population and culture as well. So what we're aiming to do is work with each of these communities to develop and co-produce bespoke carer engagement strategies that will then feed into our wider trust engagement strategy. I say that these are our initial communities because there are so many more that we would like to work with, but we think this is a really good starting point for our trust. We also recognise that within some of these communities there will be a lot of further differences as well. So as a scoping exercise, that's kind of one of the key purposes really of what we're trying to achieve. Now, some of these sub-projects have already started in small niche areas, so alongside other projects that we're working on in regards to engagement with these communities. Some of them we haven't started any kind of work, so we've gone quite broad in terms of how we're going to work with them. Next slide, please. So our older carers in rural populations, we have a relatively new service in the north mid of our county, which is kind of the Basingstoke area. It's the Urgent Community Response Team, and the idea of it is it's there to serve service users, typically in rural parts of the communities, to avoid hospital admission and to maintain their care as much as possible at home. But the team up there were very keen to get involved in this particular project because they were recognising more and more that the population they serve are often supported by older carers, and typically we need to be supporting those carers to look after the service users to maintain them at home as well. So that was already quite a key thing that particular team were excited and identified. The team have identified several individual carers and are now starting some interviews and conversations with these carers about how better to engage with them and to support them moving forward. Next slide, please. So our young carers remit is one of these broader remits. We know that within Southampton we have been supporting with developing a strategy for young carers within Southampton City specifically, but obviously this is just specific to Southampton City. It's not potentially going to be adaptable to the New Forest area, for example. So we also work closely with a number of organisations for young people already. So for example, Unlock support with our youth board and our youth governors that we have here in the trust. But again, this isn't necessarily specific enough to young carers. It's kind of a bit broader than that. So we've started some initial conversations with the Hampshire Young Carers Alliance. This is a collective of, I think, 20 or so services that support young carers already. And from here, we aim to explore multiple options for how we can hear the voices of young carers, because for some of them, they may want to talk to us directly. Some of them may just want to provide anonymous feedback. Some may want to talk to the services that already support them and have that information provided to us. So whatever works for them, really. Next slide, please. Travelling in Gypsy communities, again, much like with the first cohort, we are building on a project that we're already collaborating on with the Margaret Clitheroe Trust to support travelling communities to access health services. So they're currently conducting a health needs analysis, and with the funding from Mind the Gap, the plan is to extend that further and more specifically to the family and carers needs within that. They're currently recruiting a few volunteers and also a paid role to support this engagement work moving forward and ongoing post-March. Next slide, please. Again, building on a separate project, this one around minority ethnic communities is going to build on an existing project in collaboration with the St Denis Activity Group and United Voices of African Associations, who are based very much within Southampton once more. But their piece of work, they've already been working with minority ethnic communities to understand their perceptions of activity groups and mental health services. The project included 33 participants, both service users and carers, and the report already demonstrates some really key recommendations, some of which are very specific to carers and our mental health services in Southampton, which we think is a fantastic starting point. those carers have already got in touch with the St Denis group lead and said that they want more engagement. So that's exciting in itself, knowing that we've done something right. We're taking the steps in the right direction. So the next step is to look at those recommendations, ensure that they do cover all of the things that the carers would want included, have a think about anything that's missing, identify the key priorities, and then work together to put together a plan on how we can address those recommendations, put them into action, but also how we can continue engagement moving forward. Next slide, please. The final one, military families. So within Hampshire, we have a very high population of military families, both serving and non-serving as well. So this is a really key area that we think we need to address quite quickly. We recently, as a trust, signed up to the Armed Forces Covenant, which is an exciting step in the right direction. Similar to the Young Carers Project, we've started very broad in terms of how we're networking across Hampshire. We know that there's a lot of services, there's a lot of organisations out there that already support military families. So initially we just wanted to network to understand more about how they work and see if there's scope for collaborating moving forward in regards to health services too. We also recognise already through engagement that engagement does need to differ potentially between different types of carers. So, for example, the project lead, Dan, he is a service user, but he's also a veteran. So his family offers him support in a very specific way around his mental health. And in another example, I was recently in hospital following some surgery, and my military husband really had to think about balancing his work and how he then was able to support me through my recovery. So there's sort of a few different ways in which this particular project could go. And that's the exciting thing, I think, about these scoping ones, is that you don't know what you don't know. And then suddenly all of these amazing things come out of the conversations. Just to note also, we do have an MOD ward within our trust, and we're very keen to explore how our standardised approach to working together with carers has been embedded within that particular team, and whether there's some more bespoke work that needs to happen there to encourage and support the families of those service users. Next slide, please. So this final slide kind of just summarises exactly all of our plans and where we're up to. For each of the projects, the idea is just to open up that initial conversation that will then continue ongoing moving forward. The first step is the networks and working with the collaborators, those people that already have a relationship and some trust with those populations that we aim to serve and engage. We then want to have conversations with, I'm calling them conversations, however that looks for the carers. We want to start having those conversations through whatever appropriate means works for them. The challenge with this is what we're trying to do is engage on engagement methods and strategies. And I think that's always quite a fun thing, because where do you begin with that kind of thing? And I think that's where our collaborators are such a huge part of this project. The next step is to draft up some bespoke engagement strategies based on the conversations that we've had, the themes that come out of those. We'll then send those back to those communities for them to comment on, to provide more feedback, and for them to really highlight those key priority areas that we need to address first and what the plan might look like moving forward. So much like, the project doesn't end for us in March. We will have those bespoke co-produced carer engagement strategies, but the idea, like I say, is just to open that conversation, and then the next step is let's move forward and just keep that as an ongoing conversation moving forward. Much like our Trust's Carers Action Plan, we develop it, we redevelop it. It's a working, living, live document, and it's constantly responding and adding items based on new feedback that we're hearing from our communities. So that will happen as well with these particular projects. I think for us, the exciting part of this project is where we're working with multiple cohorts. There's so much that we're going to learn in terms of similarities and differences, perhaps between a lot of overlap. Just thinking about a military family that may have a serving military personnel with health condition, and maybe they've got a young carer that's part of that family as well. So there's going to be a lot of overlap, which I think will be interesting to learn from. And for us as an engagement team, it's going to just be a really fantastic learning experience, and an opportunity to really think outside the box in terms of how we incorporate new engagement strategies and methods into everything that we do. Thank you very much. Last slide. I think the last slide just acknowledges and says thanks to the project leads that have been supporting me with this particular project, and the rest of the people that have all been involved so far. Thank you.
Oh, thank you, Amelia. That's really good. I think we've had some. Did you have any questions? I think I saw some hands being raised up or some questions in the chat box. Oh, there's a comment from Katie Humphrey. Says she will be very much interested in linking up with you because they do the Courage for Carers work and veterans carers with the Frimley Health and Care ICS. So yeah, we'll send you the email for Katie and her team, Karen. I think they're the next ones up actually. So yeah, we'll have Katie, Karen, and John for the Courage for Carers, veterans carers work, please.
Thanks, Steve. Yes, Amelia and I know each other, so we'll follow that up separately. Thank you for this opportunity to speak. So today I'm going to be joined by John, who is one of our peer support workers, and Gemma from the Ripple Pond as well. So as you said, we're putting this bid forward from the Frimley ICS, and our project is aimed at friends, family and carers supporting the veterans community. And when we talk about veterans, really that's anyone who served at least one day in Her Majesty's Armed Forces, be that the regular or the reserves. We talk about service leavers as well sometimes, and that term is for anyone who's in transition from or who has ceased to be a member of the armed forces. And when we refer to veteran throughout this presentation, that could be anyone from any of the armed forces personnel. So Amelia also mentioned the Armed Forces Covenant. Berkshire Healthcare have signed up to that. And that's to ensure that within healthcare, veterans experience no disadvantage in accessing timely, comprehensive and effective healthcare, and that's in relation to themselves and their family. But the point there is really it's about parity and not priority, as I've been briefed to say. So next slide, please. So who are we? We're submitting through the Frimley ICS, but actually Berkshire Healthcare falls into two different ICS footprints. So we're also part of Berkshire, Oxfordshire and Buckinghamshire. And to complicate things further, the Operation Courage services that we provide actually are across Berkshire, Hampshire, the Isle of Wight, Oxfordshire and Buckinghamshire. So it's quite a big geographical area. And when we talk about Op Courage, that's the new name for our veterans mental health and wellbeing services. So that covers services like the transition, intervention and liaison services and mental health complex treatment services. We've also, as part of the bid, invited the Ripple Pond to work with us, who are a registered charity who offer peer support to armed forces families, and we're working in partnership, and they work in partnership, with a number of other organisations. And that was one of the feedback from our original bid, that we should link in with the voluntary sector partners, and it's been invaluable, the support that we've had from Gemma and her team. So the next slide, please. I'm going to hand over to John, who's going to explain a little bit about the background to the bid and our thinking.
If you can keep clicking and for a bit, because it's one of these awful build slides that's going to go forever. So I thought we thought we had command of our own destiny on this one, but clearly
I may have gone a bit mad with the transitions when we set it up. Sorry.
And I think one more as well, please, if you could. There you go. Awesome. Thank you very much. My name's John. I'm a veteran of the Army. I was 22 years service and left with physical and mental health conditions, which my family as a whole have been affected by. So I have got quite a lot of experience of what it is from a carer's point of view, and very much speaking with other veterans as well within our own service to sort of come up with bits and pieces with this. But as Amelia was saying in the previous presentation, one of the things that we're looking at the moment is to build on actively engaging with the support networks that are already out there, because it is key it is pointless trying to engage with the veteran in terms of their mental health if you're not actually looking at the people who they're going to be sat with for most of the time when they're away from getting any kind of assistance. But it's also incredibly important that those carers get that support in their own right, and that needs to be recognised and addressed. There can be quite a lot of organisations out there which are providing assistance, but sometimes it's actually not knowing in what direction is best to travel, which is one of the problems. And a lot of the problems that we're already sort of bumping up against is the fact that going through the MOD, and again taking this from a personal experience, the way that the MOD produces medical notes and medical letters and things like that can be quite different to how the NHS produces them. So there can be a great level of confusion there. And one of the most important things is just trying to make sure that everybody understands in terms of consent when they're moving across backwards and forwards from the carers and the clients themselves, which is a key area that we're finding quite strange. Not in any kind of it's more in the sense of the veterans not understanding exactly that they can now give consent to what's actually happening with them. In terms of the literature review that we've been doing, there is quite a bit of information out there, but we still need to make sure that we can actually get to the important stuff that's there. And also with the idea of Op Courage now being launched, as Katie was saying, we still need to clear up the idea of Op Courage is there, so it's one sort of the capstone organisation, so that people are coming through in the first place, rather than feeling like they need to get to any specific service. Sort of just get into Op Courage and we will assist you. In terms of the Live Bad experience that we've got so far, and this has been just in our scoping and discussion amongst veterans who are within our own service ourselves, the big changes that we're seeing for carers is the change from a very strict uniform kind of structure, very rank-based structure, where people will often not speak up for fear of having an impact on people's careers. And a lot of the changes can happen in something simple, just as housing. When you're serving in the armed forces, you can be moving around, you can be expected to move around on a regular basis, but you'll be moved into a house and then you'll be moved out to another one. All of a sudden, when you become a veteran family, that is throwing it out. All of a sudden, you've got to actually sort of sort this all out of yourself, which can actually have a massive impact if this is not something that you've been used to addressing throughout your career. Now, in terms of the carers themselves, one of the things that we've identified already is, as it says there, is their own aspirations do often take a second place to the actual serving personnel. And one of the key things when I was talking through with my wife about this, that she wanted me to make sure that I emphasize, was her hatred of the word dependent. She's not a dependent, despite what the MOD might like to think it labels her, and it does even had an ID card which said dependent on it. That was some very interesting conversations, I can tell you. Whereas she, there are a lot of families now have a lot of their own aspirations, their career. They'll have their own careers, their own aspirations, which more often than not, unfortunately, due to the way that the military works, can be played second fiddle, which is wrong. And additionally, when you come to actually leave, all of a sudden, the opportunities that are available to carers and friends and family of people who are working with them can be very difficult as well. You're coming in a later age of your life in terms of qualifications. What have you been doing? Where have you been moving around? All that kind of stuff. And I think one of the key things, I suppose, with the carers is that when you're living with in the military is quite a very tight-knit community. And sometimes when you actually become a veteran, you're moving outside that community for the first time, and there can be a loss of friendship, there can be a loss of support, and it can leave a lot of people feeling extremely vulnerable. And you know, the carers, the impact on the carer who are helping the veteran can be absolutely massive. And the last point that I would draw your attention to on there is also the impact on the children coming through. I've heard it so many times through my career of children are resilient. Yeah, they don't have to be, and we shouldn't expect them to be. And I think with the fact of them changing schools as well, quite often changing peer groups can be a real impact on it. So these are the bits and pieces that we've identified so far from what we've done, but we're well aware that there's lots of bits and pieces that we haven't identified yet, because it is such a diverse group of people who we're working with diversity backgrounds, needs, and exactly what they want to get out of the service as well. So that gives you a little bit of a background to our bid.
Thank you, John. Next slide, please, Steve. You're going to have to do a bit of clicking here as well, because I went a bit mad. So the aim really that we've got here is that we're going to gather that feedback on those attitudes and experiences of the family and relatives of our armed forces veterans. What we're saying is those who have accessed our mental health services, but also those who might access. We were thinking that we wanted it just in a bit broader, but actually we've realised with the time constraints of the project, we want to funnel it down to be quite specific to those services. So the audience, if you could click again, please, Steve, and again, is those people, and we'll be collecting some demographic information on their age, gender, the occupation, the military organisation they were affiliated to, their length of service, perhaps how long ago it was, how long they've been a carer, and also whether one of the things Gemma mentioned from the Ripple Pond was actually the carer might have met their veteran after their military experience, so they might not personally have had that relationship with the military and not understand all of the implications of that and the different layers involved. So those are one of the things that we want to think about as well. And how are we going to do all this? Well, if you could click again, please, Steve, the method that we're going to use, and again, is through survey and focus group. And again, the Ripple Pond have been really helpful here, because what they're sharing their membership with us. So we're going to be contacting people through the Ripple Pond and through our own services to get that cross section of views. So some people that have had an introduction to our services and some that may not know anything about us, and we're going to be having a survey and a focus group done remotely in December. So next slide, please, Steve. And if you could do 2 more clicks for me, please, to bring all that perfect. So really at the moment we're at the planning stage, so we've set up the project group, which has got very much a cross-section and partnership approach of ICS colleagues, voluntary sector colleagues, carers, obviously, importantly, crucially, operational managers, some of our psychological therapists, our veteran peer support workers, and a communications manager. Now we were going to include a little link there to the Ripple Pond to share a story from somebody called Sarah, who really captures what it is to have that positive experience and get the help that she was needing at the time that she needed it. So we're not going to have time to share that with you today, but I'd recommend you go and look at it, because it's a fantastic 2-minute video. But what it does is it really captures what we want to do with our outputs, to see the benefit that they could have to somebody and the support that they could have to somebody and that positive experience. Obviously, we also have identified in our project group some of the risks identified with the timescales involved in the project. It's going to be difficult to meet with people, have the discussions, and then actually come up with some of the outputs that we potentially want to do. And also whether the individuals themselves as carers have got the time to engage with you because of their additional responsibilities. But hopefully we've factored in things within our timescales to do all of that. But one other thing that we wanted to also mention is that having some of these conversations might actually trigger some kind of emotional or overwhelming issues for people, and that we wanted to make sure if that did happen that we've got support measures in place to talk them through that. Next slide, please, Steve. So at the moment, we've really concentrated on the themes that we want to cover in the focus group. You're going to have to click, 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 Steve. We've talked about this a lot. Everybody's talked about the terminology of being a carer. Do people see themselves as carers? We've got questions that we've kind of developed that we really want to concentrate on that. The perceptions about the existing support that they might be able to get and how they can access it. And really, is there something different about caring for a veteran? And part of that also might be whether it's that whole family unit that are carers. Are the children a little bit more engaged in the care and support of the veteran as well? Is there something to drill down into in that? And also, one of the other things that one of our psychologists said is that often the carer might be the first person to push their veteran to the service to get the support they need. So it might not be only about accessing support for the veteran, but also accessing support for the carer and promoting that. So our general sort of aims for our outputs are going to be raising awareness of families about the support that we've got, and hopefully some improvements in what we deliver, promoting that veteran awareness training to healthcare professionals as well, because we've identified in some of the literature review that some of the specialists in healthcare professions might not be as familiar with some of the particular challenges of the veteran community as well. So we want something that we can hopefully share and deliver with that. So we're thinking of things, and obviously in the bid we put forward some suggestions that it might be a video, it might be peer support networks, it might be training materials, but actually we didn't want to be very specific at this stage. We want to take the drive from our carers and the feedback in the focus group about what our outputs are going to be, and we'll be working towards those going forward. So next slide please, Steve, and a click. So what we've done so far is kind of all that sort of scene setting, and if you could click again, Steve, for what we're hoping to do for the next stage, we'll be implementing, we're going to really have the focus group reflect on what's come forward, identify what those outputs are going to be specifically, involve our carers in developing those in more detail, and that's going to happen between December and February, and we can give updates on that at the next talks that we're going to do. These talks again, aren't we, in shared sessions? And then if you could click again please, Steve, and then hopefully obviously at the end of that March onwards we'd have that evaluation of what it is that we've come up with. Something that we're already working on is a particular area on our website, and so we hope to host some of these things there so that there will be that sustainability and accessibility across the ICS and other areas for anything that we learn that we can then share. So next slide please. I think that's it. Any questions? And thanks for this opportunity to share our ideas, to hear your ideas about what you're all doing, because there's so much overlap in some of this stuff within the different specialist communities that we're working in, and we can all share and learn, and it's really encouraging. Yeah, so thank you.
Thank you, Katie. Any questions for Katie there before we break off for lunch?
Thank you for bearing with us before lunch. Hope we didn't lose too many people on the way.
No, that's fine. Thank you very much. Okay, we'll break off for lunch now. I know we're all hungry. I am hungry. So if we break off for lunch now, and if we can come back at 1 o'clock, if that's okay with everybody. Thank you very much. See you at 1.
No, can't. They've muted it.
I just heard you then, Sam. You can unmute yourself.
Hey Sam, how you doing?
You can hear me. Hello. Hi,
You
Andy.
right? How we doing? All right?
Yeah, you?
Yeah, good, thanks.
Good.
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 Good. That's cool. All right, Chris, how we doing? Can't hear you, Chris. But
there you go. Afternoon all.
Hi, Chris.
All.
You okay, Sam?
Yeah, how are you?
I'm okay. We've had 2 projects so far which involve veterans because Hampshire, even though they're looking at other communities of people, they're doing a specific bit of work around veterans. And in fact, they've got an Armed Forces Carers Network there, which we'll have to investigate. Then Blackpool, even though they're looking at young carers, they're particularly interested in young carers in the armed forces world as well. So there's quite a bit of interest in veterans. How about that, Andy? People are interested in you.
Really? That's amazing.
Brilliant.
So how's the rest of it gone? All right?
Yeah, I mean, as with all these things, it's a lot to pack in. You know, there's quite a few projects giving presentations, so it's quite a marathon.
Yeah, I can imagine. Okay. Unfortunately, once sort of my part in this is done because of what we've got going on at the hub today, I'm going to have to sort of dip out.
No, it's fine. That's fine.
You know, because we've got.
Is this your building work?
Say again.
Is this the building work?
Yeah. So we've got there's a lot going on. We've got the building work still taking place. We've got quite a few guys in today. We've got some coming to see us later on. So it's just a little bit chaotic, but we're getting on top of it all.
Yeah. And are you doing your remembrance tomorrow morning at the hub or elsewhere?
Yeah. So tomorrow morning we'll have a small service down at the hub. That'll be run by basically a local padre. And then, you know, the main service will be on Sunday, but we're going to do our own little thing here tomorrow as well. And you guys, if you're around, you know, if you're here for if you could get here for 10:30, you're welcome to come and see it and be part of it.
Love to, but I'm stuck up here. Same for you, Sam, isn't it?
Yeah, I think so. Yeah.
Okay.
Unfortunately.
Yeah. But yeah, it's only going to be a small thing anyway, you know. And I think what we're going to do, because it's the end of the Afghan campaign, the guy leading the service, he's ex-forces himself, so he'll make it quite personal to everyone, and there will be an opportunity for everyone during that time to do something you don't usually do at the main parades, which are if we want to say the names of our colleagues that have we lost in Afghan. And it's quite a powerful thing, I think, to be able to say them names out loud, you know, as a group.
Yeah. Yeah, it must be really sad for you, that.
Yeah, it will be. I think so I'm used to it. I mean, I am you know, the whole Afghan campaign, I've been involved in it since the beginning, so you know, the whole drawdown and everything, everyone's got mixed feelings about it really, but you know, it is what it is. We move on, you know. There you go. Right, something's happening to my screen.
Hello everybody, are we all back on?
Hello.
Sorry, my Teams is still playing up. If I put my camera on, I'll lose everything, so just the microphone for me, thank you. If we're all back on, we'll continue with the second phase of the session, and thank to everybody for presenting in the first phase in the morning. And again, please feel free to share any ideas, comments in the chat box. It's an opportunity for us to make connections, so please do put your email addresses with anybody that you feel like you can connect with during the session. Our next presentation is coming from Lancashire and South Cumbria, which is Can You See Me? Children Who Care, Young Carers, which is by Faye Atherton and Kate Aldridge.
Faye can't make it, so you've got me.
No, that's good. Cheers, thank you.
All right, thank you. Hi, my name's Sam Kirkbride. I'm Young Carers Senior Practitioner at Blackpool Carers Centre. So if you just go to the next slide, please. Thank you. So Blackpool Carers Centre, so who do we support? So we support unpaid carers in Blackpool from age 5. So that's including adult carers, young adult carers, and then we have a separate project within the young carers team called the Family Focus Project. And that project focuses solely on young carers who care for a parent with poor mental health or with substance misuse. So it still falls under the young carers bracket, but they just support slightly differently. Next slide, please. So how do we support? We support, I'm going to focus specifically on young carers because that's kind of what the funding's around. So provide respite opportunities, one-to-one support, family support, access to grants, benefits advice and volunteering opportunities. So that is across the service, but as well for young carers. Next slide, please. So why do we support? And I think a lot of this has been covered throughout this morning as well, so it probably won't be new information to a lot of you. We know many individuals don't recognise themselves as a carer. That's been a really common theme throughout this morning as well, and they're unaware of the support they're actually entitled to. As many as 1 in 5 secondary school children will provide practical and or emotional support for somebody at home. I know it was mentioned previously as well regarding the last census. So in Blackpool, there are 16,000 unpaid carers. I think we currently support 8,000. So a lot of the work we do is around identification and finding those hidden young carers and adult carers, and to improve the health and well-being of carers and ensure that there's no inappropriate levels of care. Next slide, please. So the project, so that was a little bit of background about who we are and what we do. So we are solely focusing on the identification of young carers within those families who are in the armed forces or veterans. It is a gap we identified within our service. It wasn't a question we regularly asked. It is now. So since we've had this funding, we have now added those questions onto our referral forms and parental consent forms, asking, is there a member of the family within the armed forces currently or previously? And it's to get that information at the first point of referral, so we have it and we can monitor it and pull it off our system, so we have that information. We find it difficult because we're trying to access a hard to reach group within a hard to reach group, so it's difficult. But we're getting there. We've had a few. Me personally being the support worker, so I will support young carers and their families through one-to-one support, through whole family support. So just from asking those questions at the first visits and first phone calls, we're getting those. We're getting the yeses. So it's really important for then us to have those conversations with them and explore what it is, what support they need, both for the young carer and for the wider family. Because I think that is really important for us. Although we primarily support that young carer, if we can support that whole family, it will hopefully in turn take some of the responsibility off that young carer. So challenges, we have come up against a couple of challenges. So when we first started this project, we do have an army barracks quite nearby us at Wheaton. That's where I first thought, right, I need to get in there, because I think a barrier that we come up against, especially with young carers, is getting that parental consent. You have to get the parental consent to work with the young carers, and a lot of parents, guardians are unaware that their child is a carer. We all know a lot of young carers just do it because they've either been born into it or it's just because it's a loved one, that's what they do. So they don't realise they're a young carer, parents don't realise they're a young carer. So our first thoughts were to get into the local army barracks, speak to the community, to the parents, to the guardians, whoever it might be, about our service, in the hopes that they will then recognise what support their child might need, and get support from us. We then learned that the army barracks, actually, we thought some of it fell under Blackpool, and it doesn't. So that is a challenge that we've had. So we've now we're now kind of going towards the local community support groups. So Blackpool Football Club Community Trust, they do a lot with armed forces community and veterans. I have reached out to a couple of the projects there. One was a coffee morning. That was for veterans, and after speaking to the guy who ran that, he said a lot of it is the kind of older age group, and they're unlikely to have children under 18, so that they were then signposted to our adult team to support them. However, they did do a football support group for veterans, so I am due to go and see them in a couple of weeks to hopefully just build those links with those local networks. I don't know if they're going to ask me to go and do a football session. I hope not, but just to get there and speak about Blackpool Carers Centre, and if they do have children who might not be practically taking on a caring role, but that it's having an impact on them. And I think that's a barrier as well. When you hear carer or young carer, a lot of people's thoughts will go straight to that practical side, and it's not that. It's not just that. It's that impact. What is that caring role, or that person's struggling with their mental health, with their physical health, what impact is that having? And that leads us on to kind of the next part, which is working with local schools. So as part of my role as a support worker, I work quite closely with the local Blackpool schools. I worked with them already, so I already had those links with them. So now a lot of my conversations with the staff at school is around, are you identifying these children who are part of this armed forces community? We've had conversations about enrolment stage, so at reception stage at year 7, are those questions on your enrolment forms? Are pastoral staff asking those questions? And that links into the work I did before around identifying young carers as a whole. If you ask a child, are you a young carer? The likelihood is that they're not going to say yes, because they don't know. So it's around asking those questions around that. Do you have to do anything before you come to school? Do you have responsibilities when you get home from school? If they're late, why are you late? Things like that. So I already had those links, so it's been really helpful now that I can then add questions around identifying those children who might be part of an armed forces in the community. So I think going forward, we're building the links with the local support services, specifically services that support members of the armed forces and veterans. I now attend the Lancashire Armed Forces Covenant Network as well. That's been really helpful. As I said before, it's not something we've been aware of it, but we've not specifically supported that community before. So I'm learning loads, which is good. There was a service that stuck in my head. I think they were called Veterans into Logistics, that support veterans into getting into work with the HGV lorries. And that's good for us to build those links so that any families that we work with, we can signpost them to them. And if it gets them into work or into volunteering, whatever it might be, that should hopefully take it off that child, that impact off that child. And the school. So I've done an assembly this morning. So assemblies are a really good way for us to get in and raise awareness of Blackpool Carers Centre, of what support we provide, of what a young carer might look like. PSHE lessons, I know that was mentioned before as well. So assemblies are fantastic, but usually there's a lot of children in that room and they're not going to want to put their hand up, identify themselves, ask questions because of that stigma. So PSHE lessons, they're a smaller group, they're more kind of personal. I think we stay behind after lesson if somebody wants to come and speak to us. So PSHE lessons are, I think, really helpful for us. I'm trying to think if I've missed anything out. Don't think I have. Has anybody got any questions?
Thanks, Samantha.
Oh, there we go. What we hope to achieve. Sorry. I don't know if I've covered that already. So yeah, adapting the initial referral forms and consent forms, as I said before, and that gets those families in at, you know, that first point of contact. So we're aware then. And more recently as well, so we have our young carers assessments that we do with the child. We've recently also adapted a family assessment, which it just helps us identify what support they feel they need, and support around, you know, anything linked to the armed forces gets identified within that assessment as well. So it's just another way of us just asking those leading questions, really. Holding awareness raising events, as I said, going into Blackpool Football Club Community Trust. Covenant meetings are really helpful for me because there's loads of services on there. And social media as well. We know the power of social media. So kind of having that through our Twitter account, Facebook, Instagram, things like that, it just gets the word out that, you know, this is a group that we support, and gets people thinking and hopefully referring into us. I think that's everything. Has anybody got any questions?
Thank you very much. There, I think we've got Andrew with his hand up.
Hi, Andy. Hi, how you doing? Sorry, just I'm just interested because it sounds really interesting what you're doing up there. Are you linked in with any sort of unit welfare teams or anything like that?
Not at the minute, no.
Right. Okay. So maybe swap emails because that'd be a good way forward.
Yeah, I'll pop my email in the chat.
Yeah, do so, and drop a line because we're linked in with a few down here, and I think if you follow that model that we're doing, that could help you up there.
Perfect. Thank you very much.
Right. Sorry for interrupting.
No, thank you.
Cheers, Andy. I think Katie said the same thing as well in the chat box to say if you can, you know, swap contacts, that will be helpful for you to link up because they're doing similar work with armed forces communities as well. So
yeah, thank you very much.
Thanks, Samantha. If you've got more questions for Samantha, please put them in the chat box, and we can pick them up later. Then we've got our next presentation coming from our Dorset, which is the Dorset Armed Forces. We've got Christopher Beale.
Thanks, Steve. Yeah, I'm Christopher Beale from Prima Life. And what I'm going to do is outline our project down here in Dorset and working with the carers in the Dorset Armed Forces community. And by doing that, I just want to highlight some of the learning we picked up so far. And then to conclude our presentation, Andy from the Veterans Hub, one of our partners in the project, will be talking about the veterans' perspective of this. Next slide, please, Steve. And then if we just go on to the next as well, please. So our partnership, Prima Life, we're a local charity down here in Dorset supporting older people and carers. But to deliver this project, we're really dependent on our partners in the Dorset Armed Forces community. So in the centre of that picture there, in the brown shorts and blue t-shirts, Andy, who you'll be hearing from. And Andy's developed a really good veterans hub down in the Weymouth area. And by the way, if you're ever down there, please do pop in. Sam and I, my colleague from Prima Life today, we've been to a lot of community initiatives, and we can't think of a more welcoming, more interesting hub than Andy's one down there. And our other main partner is the Defence Medical Welfare Charity. So next to Andy there in the photo is Charlotte, who works for that charity and also a veteran. And she's an outreach worker for the charity, working from Andy's hub down there in Weymouth, supporting local veterans. Next slide, please. So the aims of our project is awareness raising and awareness raising and awareness raising. We want to do more, as our colleagues in Hampshire and Frinley and Blackpool have just highlighted, in just raising awareness of what caring is within the armed forces community, but also awareness raising of the needs and aspiration of the carers amongst our statutory and voluntary sector partners. there's a significant underrepresentation, as we've been talking about most of the communities today, of carers from the armed forces community in NHS records, in the support we provide, and that's one of the key things we want to address in the long run. Interestingly, the Royal British Legion has just recently published a key report into carers in the armed forces community, and their basic conclusion is there has to be more awareness raising, so there's real serendipity there. On the positive side, one key bit of learning is that veterans themselves are really proactive in developing their own support networks. So there's a lot to build on down here. There's a lot of motivation, there's a lot of enthusiasm, and there's a lot of thinking, which hopefully we can benefit from. Next slide, please, Steve. What we also want to do is work with carers from the armed forces community and getting them to share their knowledge, their expertise with NHS colleagues, local authority colleagues, and voluntary sector colleagues, so that the latter are just more aware of the needs and the aspirations of that community. And then lastly, as a formal thing, next February time, we want to get together with members of our local Covenant Board, the NHS CCG, and also local authorities to start developing a longer term plan to support carers. And this very much goes back to what Katie was saying from Frimley. We're identifying a lot of known unknowns, which are going to have to be further investigated, further explored over the coming years. We're not going to be able to achieve everything in our project. Next slide, please, Steve. So the role of the carer in our project, there's a number of roles. I mean, fundamentally, we need to hear about what they think. So just any feedback we can get from carers will just be very, very valuable and important. Number two, we want to work with them in developing peer support networks. As you probably know yourselves, sometimes the most effective way of helping people is not through the NHS, is not through charity, but through peers, making sure people are aware of what local support there is and helping them to motivate other members of their networks to access that. As I said earlier, we want to work with carers in raising awareness of the needs of carers from the armed forces community amongst the NHS. And like many of the projects today, we want to see carers co-designing the services, co-designing the plans alongside other colleagues. Lastly, a bit of learning, and again, sort of like positive stuff. I counted up that at the moment, we're trying to engaging with 26 different partners and networks down here in Dorset. So when you think of your own work, and you know, quite rightly, you know, as I think our colleague from Blackpool was saying, it's not always easy to engage with everybody, but there's a lot to build on. Like the other projects, one of the key bits of learning we're getting from this is really understanding the culture of the armed forces veterans, and Andy will be unpacking that a bit more. And particularly we want to look at the role of children as carers, the role of serving personnel, and last but not least, in conclusion from myself, I think it'll be really important, as Katie has already said from Frimley, that we get together the projects who are working on veterans, because I think there's a lot to be shared between us. Thank you. Andy, do you want to take over, please?
I think you're on mute, Andy. See if I can unmute you.
It's all right, I've done it. Hello.
Yeah.
Sorry about that, guys. I can't really follow on too much from Chris because I think he covered most bases there. But to give you a brief introduction, we run a project down here in the southwest, the Veterans Hub, which is basically a project built from the ground up by veterans and their sort of family members. It's open to the whole community, but you know, our sort of primary service user, I guess, the people we target are people from the armed forces community. It came about from my own experiences. So I've got PTSD, depression, anxiety, and about a million and one other things going on. When I first got diagnosed with that, my then partner and myself were very isolated because we didn't understand what support networks there were out there. I don't think my partner saw herself as being a carer as such. She was doing it, looking after me because she was my partner. But we very much decided to become a self-help organisation. We set out to veterans supporting veterans, so basically decided, you know, let's look after each other and look after ourselves. That's where the project was born from. We have a community cafe run by the service users. We have gardens, allotments. We've got a gym. We've just got. We're in the process of setting up a permanent welfare office, and we've also got a small shop. Again, it's all run by veterans and their family members. What we find is might be useful for some of you to know is, especially those looking to support people within the armed forces, we're very insular. So people in the armed forces generally, especially veterans, don't really put a lot of faith or trust in organisations outside of the military. Okay, they prefer to deal with people that have experience of the military, have been in the military, have worked closely alongside the military for some time. And that's just the way it is, unfortunately, you know, and that is a barrier. It's a barrier we're trying to break down through this project. That's why we opened the hub up to absolutely all and sundry, and that's why we're pleased to have Prima Life on board as well. We do see a lot of carers, but again, as people have discussed previously, I guess, what we would class as carers, individuals don't see themselves as being carers. Okay, so yeah, the husband or wife who's looking after someone with a mental or physical disability or injury will see it as being part of their duty because they love that person as opposed to the fact they're a carer. So, you know, we have a lot of people here that hold down full-time jobs, and then when they're not working, they're also caring for people with really complex mental and physical health needs. Again, with children, so we have, I think the youngest person I know who could be classed as a carer here is about 10 years old. But again, she doesn't class herself as a carer, nor does her dad, because they're a family unit. And with veterans as well, especially, and even family members that have grown up in, say, garrisons or, you know, in sort of military sort of fraternity, as it were, they're very much taught to self-help and not reach out for support. So that's one of the issues you're going to have as well, I think. You know, we're very self-sufficient, so and when someone does reach out for help, it's often, if you had an armed forces veteran or even a family member coming to one of your organisations and saying, I need help, you're kind of that last port of call. So they've exhausted all other possibilities between themselves and their peers. So usually you won't see a veteran reaching out until they've hit crisis point, unfortunately, which is really sad. So what we try to do down here in the hub is we're open door policy, we educate, we're very open about everything we discuss, we talk about our own issues, and it is, like I say, about interagency working as well. So Prima Life, the MWS, RBL, SAFA, Dorset Volunteers, they all have a presence here at the hub. Yeah, and that's about it really, I think. I don't know if you need anything else from me.
That's brilliant, Andy.
But I will just add to that quickly. I cannot reiterate enough how it's such a hard, getting involved in veteran support is a really, really difficult task. And, you know, we're basically taught from day dot when we start training, you know, don't reach out for help, you do this yourself and you keep it all in, you know, it's kind of all in-house, if that makes sense, which unfortunately later on in life becomes a failing because, you know, families fall through the cracks or don't know how to reach out for help. But anyway, sorry, go on.
Thanks, Andy. I think it is important, especially hearing from yourself with the lived experience and the importance of the support that you're getting from the hub and the support that you're providing for other veterans as well. That's really important. I don't know, Chris, did you want to add anything else before we move on? Or take any questions?
That's it. That's it. Thank you. And big thank you, Andy.
Thanks, Andy. Any questions for Chris and Andy? If you do, please pop them in the chat box and we can pick them up later if you have. We'll move on to our next presentation, which is the Northeastern Cumbria ICS, which is using peer-based research approach to understand what matters most to carers of people with drug and alcohol misuse. And that's with Hazel. Hazel, are you online?
I am, thanks, but Nicola's going to do the presentation. Thanks very much.
Okay.
Hiya, thanks Hazel. Yep, so welcome. My name's Nicola and I work for First Contact Clinical. We're a social enterprise company that have been established since 2003. If we can move on to the next slide, actually, thanks. I'm joined here by Hazel Cuthbertson, so Hazel's representing the local authority. And the kind of bid for the funding for Mind the Gap was co-developed between the local authority, ourselves. We also had colleagues from public health and other VCSE providers, including our local carers organisations who all got involved within that. So the aim of what we're going to use the monies for is to understand what matters to the unpaid adult carers of people with alcohol and drug misuse. So as we've already heard today from some of the other projects, we know they're an underrepresented group and we know some of the reasons why that is. But we want to kind of understand more about that so that services can adapt and flex to meet the needs and provide support to people who really need it. The aim of this is that the findings will inform at an ICS level, but also at local level as well. And they'll directly kind of contribute to our local carer strategy, so that it's tangible outcomes from the information that we gather. Next slide, please. So what we actually found in the past. So First Contact Clinical previously held the substance misuse recovery contract for South Tyneside. So we've done a lot of work with people who go through recovery journey, and we know that when you're on a recovery journey, you're often asked about who's in your support network, who's giving you support, but actually there isn't much consideration necessarily given to those people as carers with needs of their own. So we know that they're sat in the background and they are supporting people on recovery journeys, but they're not necessarily having their own needs met. So that's part of the reason why we wanted to particularly focus on this cohort. As well as that, some of the data that we've got is that especially during the pandemic, alcohol consumption in particular has increased quite significantly. So, that it kind of, it's understood that there will be carers sat behind that. There'll be people supporting people throughout alcohol misuse that we're not aware of and will have needs that need to be addressed. So that's kind of the rationale as to why we're focusing on this particular cohort. Next slide, please. So the way that we're delivering the project is kind of in two main strands. The first of which is around kind of your generic sort of usual focus group approach. So to do that, we're connecting in with a number of organisations in the area. So that's not just recovery-based organisations, but also carers-based organisations. Basically, what we're trying to do is provide access to where anybody who might be caring might present. And obviously, because we know that underrepresented carers aren't, they're not putting their hand up and necessarily going to an organisation and saying I'm a carer and I need some support. Those gateways might present all over the system and not necessarily in the organisations that we would usually think of straight away. So we're really trying to kind of push out into all kind of areas. So an example of that, for example, we've worked with Northumbria Police. So we've got the community support officers who attend incidents and kind of see families, keeping an eye out as well for kind of where carers might be presenting. So yeah, we're kind of working all across the system to try and identify some people to kind of speak to. It mentions there as well that we're also speaking with members of the armed forces community. So good to hear that some other projects across the country are doing something similar, and I think we'll probably be in touch. But the kind of reason for that is another project that we're running. We got some money from the Armed Forces Covenant Fund, and that was particularly to provide a link worker model for people within the armed forces community. So that was around us understanding why people don't use the services that are kind of on offer for them, and develop some learning around that would then inform system changes. And we could do that through training and peer support stuff. What we found is doing the two projects in isolation, that there's crossover. We're coming across veteran carers who are also potentially in recovery services as well. So it makes no sense to keep that data apart. So we're factoring that data into our final report and into the activities that we're doing as part of Mind the Gap as well. The second strand that we're doing as well is participatory based research. So what we're actually hoping to get from some of the focus groups is volunteers who will then do some training with us. Now that training's around kind of research methods, how to conduct research, how to develop a report, so that actually those volunteers will go out into the local communities and do a bit of research for us. Part of the reason for that is, again, addressing some of the accessibility and stigma issues. You know, there's people who have got views and experiences that we want to hear, and they're not going to put their hand up and they're not going to come forward and tell us, but they might tell a peer. So we're hoping to get some kind of more in-depth information by peers going out and doing some of that research for us. They'll then come back as part of that training, and we'll be supporting them to develop the final report themselves. So the kind of it's information gathering for us, but it's also skills development for the individuals that take part. So they're the two main strands that we're kind of taking forward. Next slide, please. So the other thing that we're trying to do as well is understand the impact of actually taking part in the research. So whilst, you know, the primary aim is around the data that we get from it, and obviously how that's going to inform systems going forward, actually the side of things of, you know, what it is that people gain from contributing to research or being part of the participatory based research around their own kind of well-being and their self-confidence and connecting with others and all those other sorts of domains. We're really interested in kind of tracking that as well. So part of the work that we've done is around developing a tool to see what impact it has on the individuals who take part, and that'll help us inform some of the voluntary sector work that happens in the borough as well. So we're really trying to maximise the use of the funding to get as much data as we can to inform as many different parts of the sector and parts of the system as possible. And as a couple of other projects have mentioned, another thing that we're hoping to do is get some like students or volunteers who are particularly IT or media savvy on board, so that instead of a, you know, however many page document that we all love to sit and read, I'm sure, over a cup of coffee, we can put something together a bit more snazzy in terms of a video or kind of audio clips or whatever. So that report is a bit more interesting for people to kind of look at. So that's kind of where we're at. A little bit of an update, because when we did the slides, things have moved on a little bit since then. So actually we've got 2 focus groups that are taking place this month with our local recovery service. So that's specifically with people who are in recovery or on a recovery journey now, reaching out to their support network. Obviously we say support network because, as many people have mentioned, they don't necessarily identify as carers. We're also setting up a third with our local adult carers organisation, and we're collaborating with NAFI Break as well, so that we're going to go in and talk to the members that attend the NAFI Break drop-in, which is the Armed Forces community locally. So I think that's it. Hazel, feel free to kind of jump in if I've missed anything important.
No, I think you covered everything beautifully, Dick. Thanks.
Thanks, Hazel. Yep, any questions? I think the next slide is just the questions slide.
Thank you, Nicola. Any questions at all for Nicola and Hazel? Again, just mentioning about linking up work. I think we've got a couple of the drug and alcohol misuse carers for people with drug and alcohol misuse. We've got about 2 projects that have presented beforehand, so it will be a good idea as well, just to sort of link up and to see how you can share sort of ideas and best practices. I will send emails just to do quick introductions, and you can take it from there, if that's okay.
Yeah, thanks. We've met up with the York project already, actually, which was really helpful for us in mobilising. But yeah, I think I've written down the Cumbria project as well as somebody else we want to chat to. So thanks, Steve.
Awesome. Cheers, Nicola. Thank you. Yeah, if you get any questions or any thoughts for Nicola and Hazel, just please put them in the chat box. We'll move on to our next presentation, which is Prince Obike from the Southeast, which is assessing the needs of South Asian carers in the Royal Borough of Windsor and Maidenhead population. Chris Prince, sorry.
Thanks, Steve. Right, okay, so it's been quite